SNAP. Gunderson is also a fellow of the Agricultural and Applied Economics Association. Thank you, Dr. Gunderson, for joining us today. We also have Dr. Dariush Mozaffarian, who is a cardiologist, dean, and John Mayer professor at the Tufts Friedman School of Nutrition, Science, and Policy, and a professor of medicine at Tufts School of Medicine. His work aims to create a food system that is nutritious, equitable, and sustainable. Dr. Mozaffarian has authored more than 450 scientific publications on dietary priorities for obesity, diabetes, and cardiovascular disease, and on evidence-based policy approaches and innovations to reduce these burdens in the US and globally. He has served on numerous advisory roles, and his work has been featured in a wide array of media outlets. Thomas Reuters has named him as one of the world's most influential scientific minds. So thank you both for being here today. We're really looking forward to your presentation. Dr. Gunderson, I think you're up first, so I'll go ahead and have you share your slides. We have 20 minutes for each talk. And then at the very end, we're not going to take questions in between. We'll have time for questions at the very end for about 10 to 15 minutes. So go ahead and feel free to put the questions in the chat as you have them, but we won't be able to ask them until the end of the presentations. And with that, without further ado, we look forward to hearing both of your perspectives. Thank you.
Okay, great. Okay, thank you. Thank you very much, Megan. I really appreciate the opportunity to speak to all of you. I wanted to begin by thanking Megan, Barbara, and Dana for really inviting me to be a part of this. At first, I think I'm the only economist speaking at this, so I appreciate this opportunity. And also, as you'll see, as some of you know, I say things that aren't always the most popular. So anyway, so I'm very thankful that you all are letting me speak to this. It's a credit to all of you that you have these voices that are being allowed to speak. I really do appreciate it. So I changed the title of my talk to why a very cumbersome title, why eliminating food insecurity and health, and hence reducing health disparities remains an important goal. I think this is a vitally important goal, and I'm going to put it in the context of the food insecurity measure. So allow me to begin. Okay. Shoot. Okay, there we go. Okay, so let's begin. I know most of the people know how we define food insecurity, but I think it's always best to be able to say, okay, let's put us all on the same page and say, here's how we define it. So is a household's food insecurity status is based upon 18 questions to something called the core food security module. And this has been in existence now for about 25 years. It began in 1996. In fact, Dana and I were talking earlier about how we were at one of the opening conferences about this. So this was developed in the early 90s, and then after multiple ways of looking at all these things, it was implemented as a measure in 1996. Since then, it's been on dozens of surveys. It's on all in some form or other, virtually all nationally representative surveys that the US government has. And I think without a doubt, I don't think it's become the leading indicator of well-being for vulnerable Americans. No other measure even comes close. And so it's become really, really important. And it's testimony to all the people at ERS and all the literally hundreds of researchers who are doing work using this measure. It's an incredibly important tool. So the examples of some of the questions that are posed when we look at, something's going on in the chat. Okay, these are 4 examples of the questions. They range from the least severe, I worried whether our food would run out before we got money to buy more, all the way up to the most severe. Did a child in the household ever not eat for a full day because you couldn't afford enough food? Okay, so all these questions, just a couple comments. All these questions have some notion about not having the resources to purchase enough food. Okay, so in other words, it's not that somebody is, intermittent fasting has become a popular thing. If you miss meals because of intermittent fasting, that doesn't count as being is registering as food insecure unless you also couldn't afford enough food. Okay. The second point is that these are episodic. It's not that every single day these things are happening. They happen over the course of the year. On average, households are food insecure for about 7 months out of the year, and within those months, not the full month. Okay, so those are 2 things about it. We then say that that a household is food insecure is if they have 3 or more affirmative responses, and then very low food secure, a more severe measure of this is if they have 8 or more affirmative responses. Okay, I keep checking the chat just in case somebody's saying I can't hear you, or you're not speaking clearly enough, or even though you live in Texas now, you still speak like somebody from Wisconsin. Yeah, I don't know what people were saying in the chat. So at any rate, is that these are the categories that are used. Now, let me present an overall picture about what food insecurity looks like in the United States. Okay, this is taken from Feeding America's Map the Meal Gap project, which is, has become really the leading measure of when we look at geography of vulnerability in the United States. And one thing I really want to emphasize is that, in some people's minds, food insecurity is no longer an issue. Why are we talking about food insecurity? This map, I think, shows pretty clearly that even in areas with relatively low food insecurity rates, you're still talking roughly 1 in 10 people are food insecure. And if you look at this, I'm not sure if you can see this, but if you look across like Appalachia, or you look across the Mississippi Delta, or you look across the Rio Bravo, you see a lot of areas with really pockets of really high rates of food insecurity. I think we need to continue to be talking about that. And one other thing I want to note is if you look up here in states like North Dakota or South Dakota with overall low rates of food insecurity, is that you have these pockets of really high, an ongoing tragedy in our country is the really high rates of food insecurity and other issues facing American Indians. And I think that this is really shown pretty clearly here. Okay, same with Alaska Natives. Okay, now I want to come to the next slide. What's happened overall? So I was talking about a few things about this, but in the interest of time, I'm just going to talk about a couple of things. Even during good economic times, like from 2000 to 2007, roughly 1 in 8 Americans are food insecure. Okay, so this is something that even during good economic times, it's a big deal. Second thing to point out is that a comparison between what happened during COVID and what happened during the Great Recession. Okay, there's a lot of projections, including some that was done by my colleagues in Feed America and myself, where we projected increases in food insecurity during COVID. Amazingly, though, as you can see here, is food insecurity rates went up slightly, but they were even lower than they were, say, in 2017, and the increase was far less than we saw during the Great Recession. Why was that? 4 main reasons. First is that there was this massive set of stimulus checks that were sent out. Okay, that was one reason why, and that flooding all this money, people could afford food. Second reason is that SNAP benefits were bumped temporarily up to the maximum. That gave vulnerable Americans a lot more resources to spend on food than they otherwise had. Third reason is just the amazing work being done by the charitable food assistance sector, including, of course, my beloved colleagues at Feeding America. There was a massive expansion in this, and they responded nimbly and quickly to food insecurity in their areas. And fourth, it's something that's often overlooked. We have an amazing ag supply chain in the United States. People are able to get safe, affordable, nutritious food so easily in our country. We had a global pandemic, and still food prices didn't rise. I mean, that was truly testimony. You had a global pandemic, but you would still go to your food stores and there was food on the shelves. I mean, sometimes, yeah, like I'm not sure if I'm allowed to say this in front of nutritionists, but I was going to sometimes buy some angel hair pasta that was made out of wheat. And I could still, sometimes I couldn't get that on the shelves. But the overall in the main, you could get whatever you wanted. Any of my shirts, but overall, as food was available, there was no shortages except in very minor cases, and prices stayed low. That's testimony. For those 4 reasons, is food insecurity didn't increase during the Great Recession and during COVID. Okay, now I want to turn to the far and away most amazing federal program that we have, SNAP, the Supplemental Nutrition Assistance Programs. I'm a huge fan of SNAP. Whenever I talk about what's great about America, I say what's great about America is SNAP. No better program that our country has this. It's a testimony to our country's desire to make sure that people are free from hunger. Okay, it's been in existence for over 50 years. It began, first on a county basis as a part of the Great Society programs, and then it became national in 1974. It's great because it's available to Americans of all ages. This isn't just a school meal program or for seniors, something like that. It's for people across the age spectrum. Okay, so everybody in the United States, if they're income eligible, can be afforded for this program. Okay, the central goal of this program is to reduce food insecurity. I mean, let's be blunt. A lot of government programs don't work so well. Some do more damage than they do good, but some programs are a success. SNAP is a success. The central goal is to reduce food insecurity, and study after study has shown that it succeeds. But it also succeeds at improving nutrition. It also succeeds at reducing healthcare costs. It also succeeds at improving health. In other words, this is an amazing program that we have in our country. We should all be thankful for what an amazing program we have. Let's talk a little bit about why this is a successful program. There's other government programs that aren't successful. Let's talk about reasons why. 5 main reasons. So the first thing is is that it reaches those most in need, okay? Is that the program it's effectively targeted, so it's gross net and gross and net income test and the asset test to reach those who are most in need, okay? So it's not universal, it's just targeted to those who most need it. Second point is that it's a generous program. One of the most amazing transformations of a program that's happened is when, beginning in 2018, as USDA was revisiting whether or not the Thrifty Food Plan was high enough. And I was involved in those meetings, and then we all said, no, it's not high enough. You can't afford to purchase a Thrifty Food Plan in about 99% of counties in the United States. It's got to be higher. And USDA raised it by 20%. Okay, fantastic news. That's the best news, most transformational thing we've had in terms of SNAP since the end of the purchase requirement back in 1979. Okay, now, so it's a max. It's you know, that's a lot of money that's being given to people. Great news. Okay. Third reason is this entitlement program. It's an entitlement program as far as the government automatically expands the program or automatically contracts automatically expands or contracts as needed. It doesn't require reauthorization to expand the program. It's also an entitlement program is that people can stand as long as they're needed. There's a number of, the average length of time in SNAP is about 11 months. However, there's a lot of people on SNAP who need this for years. It's wonderful that we have a program that gives support to Americans and helps them out. And it doesn't impose any requirements on them. Fourth thing is it can be used at virtually all retail food outlets. Really, no one in America can't get to a food store that doesn't have SNAP. I mean, a very small proportion, in some limited instances, but it's available at all retail food outlets. The final thing is the most important. You know, it's hard being poor in America. And one of the things that makes it hard to be poor in America is many things. Some people stigmatize those who are poor. Some people stigmatize those who are rich. There's also these people who like to stigmatize people who are in line with their shopping carts filled with purchases. They see them purchasing what they consider bad things with SNAP benefits, and those people condemn them. It's hard being poor in America, okay? The beauty of SNAP, though, is that it's not a bunch of government bureaucrats dictating what you can and can't purchase with SNAP. It gives them the autonomy to make their own food purchases. It also gives them the dignity to be alongside their friends and neighbors when they're shopping and making choices they think are culturally appropriate for their family, appropriate with respect to their preferences of their family. This is giving dignity and autonomy to major. We have too many government programs that don't give dignity. And I could talk about some other food assistance programs that don't do this. Dignity and autonomy is incredibly important. It's hard enough being poor in the United States. Let's give them dignity and autonomy. Okay, so I have about 8 more minutes left. Okay, now, let me just, before turning to something, I always put up this slide, is that you have a lot of people, from both sides of the aisle who think, oh, SNAP, that it's only SNAP recipients mainly go to convenience stores or other places to do their shopping. That's false. Okay, it's completely false. Is that I think part of the misperception with respect to this is that convenience stores is almost half of all retail food outlets, excepting SNAP, are convenience stores. However, if you look at redemptions, over half are at the superstore, at the Walmarts, the Meijers, places like this. Another 30% are at supermarkets. Okay, so about 80% of Americans who are on SNAP are shopping at places where they have full access to safe, affordable, and nutritious food. It's a myth in the United States, and this is why the food deserts literature and all that stuff has been completely debunked, is that people don't have access. It may not be easy to get to these places, but you can always go there, okay? 1/3 of all SNAP dollars are spent at Walmart, for example. So we need to get rid of this myth that food access is an issue in the United States. It just isn't. SNAP is great. Now let me turn to nutrition security. Okay, let me skip over this, ways to enhance SNAP. Actually, I'll briefly talk about it. 4 things. One thing is I have a paper that came out in Food Policy, which argues for why we would want SNAP as a modified UBI program, and just the profound ways of reduce it, essentially eliminate food insecurity in the United States. So whenever somebody says we can't eliminate food insecurity in the United States, I'm like, yeah, if we had the will to do it, we easily could do it. It's no problem at all to completely eliminate food insecurity. Other steps you can take: first, make it easier to enter the program and easier to recertify benefits. Second, increase benefit levels. This is already done. There's a paper that Brent Kreider, John Pepper, and I, 2 of my amazing co-authors, we wrote back in 2018, basically made the same argument that USDA made for increasing the thrifty food plan, and we showed pretty dramatic declines in food insecurity. So we'll see if that actually plays out with all of this. So if any of the issue came out as a Russell Sage Foundation paper. The third thing is expanding eligibility. Many Americans are food insecure, but not ineligible for SNAP. And expanding eligibility would be great. And the other thing is to rethink the benefit formula. This really came about because of some great work. I mean, I think many of you know who Hillary Seligman is, one of my other amazing co-authors. She's fantastic. And she's on the West Coast with all of you. But at any rate, she kind of began to think, maybe the benefit reduction formula is not correctly specified for SNAP. So let's rethink that. So these are some of the things we could do. SNAP is already amazing. Don't mess with it. Don't change it up in weird ways like restricting what people can purchase. Don't do crazy things like that, of course. Instead, do what's posted here. Okay, now we want to turn to quote unquote nutrition security. Okay, now coming back, at the beginning of this, I said that, food insecurity, we developed food insecurity measurement for about, 10 years before it was rolled out. There was a lot of discussion and everything. So we know how to measure food insecurity. It's become the established thing. Unfortunately, with nutrition security, it's still a vague term that nobody has precisely identified. So if you want to say what's happening with nutrition security, I talk to some people, it's just like HEI, or it's just like obesity, or it's just like these other things. Nobody really has a concrete measure of what it is. That makes it difficult for anybody to say, here's what it is, because at least with food insecurity, if you don't like it, you can say, here's why I don't like it. Okay. It's a culturally insensitive measure. I can't believe that everybody says it's a culturally insensitive, those of us who have looked at this thing and those of us in the anti-hunger community. Basically, it's telling people that if you don't eat what's prescribed by persons in that corridor from Boston down to Washington, D.C., and then some people on the West Coast, if you're not eating those foods, that's wrong. Well, there's a lot of people with different cultures that choose to purchase and eat different things. They will be condemned under this. And I, for one, do not want to be culturally insensitive. With SNAP, is we give people the dignity and autonomy to make their own choices consistent with their culture. Far be it from me to tell other people from different cultures what they can and can't eat. The other thing is it places blame on vulnerable Americans. If somebody in the United States is not, quote unquote, nutritionally secure, I mean, we can't say it's because or I should say, put it this way, I would definitely be defined as nutritionally insecure. Okay, my BMI is 28. Can you believe that, a BMI of 28? I would be considered nutritionally insecure. Or, for example, I enjoy drinking wine, and sometimes on rare occasions I may have more than 2 glasses. I also enjoy eating meat. I also enjoy eating buttermilk on top of my oatmeal. All these things would be considered bad things for nutritional insecurity. I don't care if somebody says, yeah, you're making all these bad decisions, Gunderson. That's fine. I don't care. But it does make a difference for those who are vulnerable. Those who are vulnerable, and we're saying, you're not making the right choices. Well, they're able to shop anywhere they want. They're at Walmart. You can purchase all these quote unquote healthy things or quote unquote unhealthy things. So in other words, I think that this notion about access, it's really not an issue. Because the reason I mention this is oftentimes people talk about nutrition security in terms of lack of access. That just isn't true. Okay. Now, what's the main problem with this? Is these proposals to quote unquote improve nutrition security would, and virtually everybody I've seen speak out on nutrition security wants to impose restrictions on SNAP purchases and wants to do all these other things to limit the dignity and autonomy of recipients, okay? And in doing so, it reduces the dignity and autonomy. It's hard being poor in the United States. It's much harder having somebody tell you, can you imagine a senior citizen being told, you can't purchase Gatorade for your child? Or a mother going to the store, my kids enjoy 2% milk. Nope, only skim milk. All these things is, if we impose restrictions on this to quote nutrition security, would be a really bad thing. What would happen? Declines in food insecurity, okay? I mean, declines in SNAP participation, because who wants to be treated like what adult wants to be treated like a 2-year-old and have the government tell them what they can and can't purchase? And hence, it will lead to increases in food insecurity. So let's be really, really careful that we don't decimate by stigmatizing and patronizing and condescending towards vulnerable Americans through any things that would decimate SNAP. To be blunt, is if nutrition security kept SNAP the way it is, I would be all in favor of it. But I've met too many people who talk about nutrition security who also talk about restricting SNAP benefits. To conclude, though, is we already have this incredible measure on food insecurity. We know that food insecurity, if we reduce it, it improves nutrition outcomes, okay? We already know if you want nutrition security, reduce food insecurity. B, it improves health. Study after study after study has shown that reducing food insecurity improves health, and correspondingly that reduces healthcare costs. And most importantly, is it reduces health disparities. If you want to reduce health disparities in the United States, reduce food insecurity, support SNAP, and don't lose sight on the fact that SNAP is a solution to these issues. Let's not mess with SNAP. If we want to talk about nutrition security, that's fine. Let's not lose sight of food insecurity. Let's not lose sight of the dignity and autonomy that SNAP recipients have.
Wonderful. Thank you, Dr. Gunderson. Dr. Mozaffarian, I'll have you go ahead and start to share your screen. Looking forward to hearing your perspective as well.
Terrific. Thank you. Can you see my screen?
Yes.
Great. So I want to talk, and I think the setup from Dr. Gunderson is perfect. How, starting on the foundation of what food security, a focus on food security has achieved, and I agree with, virtually all the things that was raised by Dr. Gunderson about what focusing on food security has achieved, why it's not been enough, and why ignoring the suffering of people from nutrition insecurity is no longer viable. And so this is really, the focus of my talk, why evolution to build on the concept, not to replace, but to build on the concept of food security is critical to addressing hunger, food security, health, and equity in the United States. And so this has been talked about, but it's worth just talking about this again, that these are the USDA definitions of food security. There's two broad definitions that the USDA uses to track and report on food security. There's low food security. Low food security is reduced quality, variety, or desirability of diet. Importantly, there's not reduced food intake here, not reduced calories, just reduced quality, variety, or desirability. And in fact, the USDA called this previously, I think, a more clear term, food insecurity without hunger. And so the vast majority of food security is about the type of food that can be purchased, not the amount of food. And that's called, again, low food security. And then there's very low food security, defined by USDA as actually multiple indications of disrupted eating patterns and or reduced food intake. So this is really where there's not enough food. And this was previously called, I think, a more clear label, food insecurity with hunger. And so these are two categories of food security, both of which are important to address. And if you look at trends over the last 20 years in food insecurity, the top bar shows total food insecurity, the combination of low and very low food security. And it's ranged, roughly between 11 or 10 and 15% in the United States over the last 20 years, which is much too high. We don't want to have anyone having challenges in the quality and desirability and availability of food. And then very low food security, which is actually disrupted eating patterns and reduced ability to purchase food. It has been ranging somewhere between 4 to 6%. And as Dr. Gunderson mentioned, this is at any time over the past year. And so households even having a few episodes over the past year, this includes those households. This is not every day for most households. And so these trends are important to look at and consider. Now we look at trends in diet-related diseases, and they look very different. And so while we've kept the trends in food insecurity, generally flat overall, we have not kept the trends in health related to nutrition flat overall. These are the trends in obesity, gone up over the same period from about 30% of the population obese to 42% of the population obese, a huge increase. And severe obesity has pretty much doubled from less than 5% to over 9%. And so huge problems when we look at weight. And if we look at diabetes has also gone up tremendously over the same time period. While food security, again, has been relatively flat, we've had huge increases in diabetes. And these diseases, beyond these cardiovascular diseases, stroke, heart disease, cancers, overwhelmingly have larger effects in low-income, rural, and minority populations. Diabetes is the #1 cause of early blindness in this country. It's the #1 cause of below-the-knee, non-traumatic below-the-knee amputations. It's the #1 cause of renal failure. As a cardiologist, I see low-income minority patients, rural patients who have heart attacks at a young age, have their legs amputated at a young age, losing their vision. I mean, they are truly suffering and causing tremendous suffering in their communities and for their families. And this is true not just for low-income Americans. This is a really, really important distinction I want to make. Food insecurity is still largely a problem for low-income Americans, although not exclusively, but nutrition insecurity, I would argue, is a problem for most Americans. More Americans today are sick than are healthy, and this is overwhelmingly due to nutrition insecurity. 1 in 2 adults in our country have diabetes or prediabetes, 1 in 2, and that has gone up, as I've shown you, over recent years. More than half of American adults have cardiovascular disease, and it's causing 840,000 deaths per year, more than COVID, 2,300 deaths per day, every day, and a lot of that is attributable to poor nutrition. 3 in 4 adults have overweight or obesity, and only 1 in 10 are metabolically healthy. And if those statistics aren't staggering, if you looked at, again, Black population, Hispanic population, a rural population, a Southeastern United States population, a low-income population, all of those numbers are far higher. And this is really harming our children. Among teens, among teenagers in this country, 1 in 4 have prediabetes, 1 in 4 have overweight or obesity, and 1 in 6 have fatty liver disease. And all of this has happened in the last 30 years. So while I agree with all of the successes of our federal policies around addressing and trying to maintain low rates of food insecurity, we have not addressed and maintained low rates of nutrition insecurity. In fact, things have gotten really terrible in the last 30 years. And the economic costs of this are crushing. So in 50 years, healthcare costs have skyrocketed from 7 to 18% of gross domestic product, from $1 in $20 in the federal budget to $1 in $3 in the federal budget, and $1 in $3 in the average state budget. So this is suffocating all of our other programs, leaving us unable to afford programs to improve nutrition, to improve housing, to improve transportation, to do all kinds of things we would want to do to help low-income Americans because of healthcare spending. Among US businesses, adjusting for inflation, healthcare costs have gone from $80 billion to $1.2 trillion. And we now spend more than $11,000 per year per man, woman, and child in the United States, more than $44,000 per year on healthcare. That's much more than the average family spends on food, housing, and transportation combined. And in fact, it's higher than the average income of most families of 4. And so, and much of this is related to diet-related chronic disease, to nutrition insecurity. 80% of healthcare dollars are spent on preventable chronic diseases. And just on diabetes, the US government spends $160 billion on direct medical costs, more than the entire budget of the USDA. And so this is not sustainable to not address nutrition in this country. And if we could address nutrition, we would reap enormous savings to improve the lives of Americans in other ways. This is an analysis from the Rockefeller Foundation published last year, estimating the true cost of food in the United States, that the food outside what we pay for it costs our economy $2.1 trillion in excess costs per year. Our economy is losing $2.1 trillion a year because of the types of food we eat. And about half of that is due to burdens on human health. And about $146 billion a year is lost due to poor health due to food insecurity. Food insecurity causes poor health, and that loses about $146 billion in healthcare spending. But nutrition insecurity, diet-related chronic diseases, are costing $1 trillion in economic losses. And so this is not sustainable to have a food system which is costing our economy $2 trillion per year. The measures of food insecurity have been highlighted. This is the standard 6-question instrument, which is often used for screening. And if you even look at the full 18-question instrument, what's striking is that while food insecurity, its text definition includes access to safe, affordable, nutritious foods, nutrition is not addressed anywhere in measures of food insecurity. The closest is the question on balanced meals. That's it, just balanced meals. There is no metric where food insecurity actually measures nutrition. And this is the problem, that we've been addressing food insecurity, but we have not been addressing nutrition insecurity. And so the limitations of just focusing on food security are unclear distinctions, screening tools, and usage between sufficient food, just calories, types and availabilities of food, which is preferences, and actually nutritionally adequate foods, which is what's critical to improve health equity, to reduce healthcare spending, and to stop the incredible challenges in our country around health. There's also, I think, suboptimal descriptions of the relevant time periods and durations of assessment for defining these constructs. As was mentioned, families could have this just one time a year, they could have this one time a month, or they could have this many times a month, but that's actually not well defined and discussed and classified in the research. And the research tends to put all of those people together. And there must be significantly important differences between those groups depending on how often they have the food insecurity. And there's, as I mentioned, no assessment of nutrition or the actual foods consumed in thinking about food security. And so this has led us and others this year to really focus on and propose that it's time to build on, not to replace, not to stop addressing and measuring food security, to continue to do that. But in addition to measuring and addressing food security, to start measuring and addressing nutrition security. And I'm really glad to hear that it took Dr. Gunderson 10 years to come up with definitions, because this is year one for us. And so we have more time to figure this out. We obviously have to come up with metrics, definitions about how to measure this and screen for this. But the concept is nutrition security is consistent access, availability, and affordability of foods and beverages that promote well-being and prevent, and if needed, even treat disease. And so this is important because we have addressed problems of food access and affordability over the last 25 years with successful government programs, but we have not addressed nutrition. And nutrition has worsened with large and rising disparities in diet-related diseases. And so we need to have this shift, just like we shifted from a focus on hunger to food security. We need to shift from just food security to adding nutrition insecurity. And this should build upon, not replace, current metrics and usage of food security. And I'm really pleased that the USDA and Secretary Vilsack have really embraced this, from his confirmation hearing to his recent talk just a couple of weeks ago at Columbia Teachers College. Secretary Vilsack has really doubling down and showing that he understands that we have to address both the access to food and nutrition. We can't have, as he says, the levels of obesity, diabetes, and chronic disease that we have. It will literally cripple everything we're doing as a country. Diabetes is linked to both food insecurity and nutrition insecurity, making it incumbent upon the USDA to modernize both and address both nutrition security and food security systems. We're dealing with twin issues, flip sides of the same coin. And if you look at, I showed you the graphs for food insecurity. There is no single definition of nutrition insecurity, but here's one potential definition. Just looking at a poor quality, nutritional quality diet. This is the percentage of adults in the United States by income who have a poor quality diet. Not even intermediate, but really an unhealthy diet that we know is increasing risks of disease. And it's stratified by the ratio of family income to poverty. And while it's slowly improved in recent years, it's gotten better. It's worse than, let's say, 30, 40 years ago, we think, but it's slowly improving. It's still quite bad. And what's striking here is the disparities. And so among higher income Americans who have a family ratio of family income to poverty of greater than 3, only 35.7% have a poor quality diet. But among low income Americans, it's 61%, a huge, huge disparity in nutrition security by income level. And if you look at children, there's similar gaps. And while children's diets have improved, and I'll show you why they've improved, it's almost entirely, the recent improvements is almost entirely due to improvements in school meals. Still, there's huge disparities and huge problems. 64% of kids in low income households have a poor quality diet, 64%, 2/3. And even among high income households, it's almost half of kids in our country have a poor nutritionally quality diet. This is not a sustainable approach for our country. We have to fix this. And if you look at kids and their diets, this is the proportion of food consumed from different sources in the United States among US children according to their source. And so again, this is the proportion of food that's actually consumed, not what's available, not what's on the grocery store shelves or on the menus, but what's actually consumed by source in the United States. And higher is worse. This is poor nutritional quality. You can see restaurants, combining full service restaurants and quick service restaurants, about 80% of all food consumed by children is of poor nutritional quality, not even intermediate and certainly not ideal. And this is using a validated American Heart Association score, which is based on really availability of healthy foods. So restaurants are a terrible place for kids to eat in the United States. If you look at grocery stores and other sources, it's about half. About half of all foods consumed from grocery stores and other sources is of poor nutritional quality. If you look at schools, in the, before 2010, almost 60% of food consumed in schools was of poor nutritional quality. And so this is why schools have a historical bad rap. Like, you don't want to eat school meals because the food is terrible. That's the historical bad rap. It was true before 2010. 55 to 60% of all food consumed, in schools was of poor nutritional quality. But look what happened after 2010. Enormous improvements, tremendous improvements in the nutritional quality of food consumed at schools, to now where today only about 24% of school meals are poor nutritional quality. Now, if you're an optimist, that's terrific. If you're a pessimist, you still say, look, 1 in 4 meals in schools are still of poor nutritional quality. That's terrible. So we need to fix it, and that's true. But on the other hand, schools are now the healthiest place that kids eat on average in the United States. Let me repeat that. Schools are the healthiest place that kids eat in the United States. And so while I agree with the importance of SNAP as a program, I think school meals and WIC have been tremendously important programs for our country. Now, what happened in 2010? What happened in 2010 to cause this enormous improvement? Well, the Healthy Hunger Free Kids Act. You had First Lady Michelle Obama and President Obama. You had a consortium of military leaders, civil society advocates for kids say, look, we need stronger nutrition standards in school. Industry opposed this. Industry says it can't happen, it won't happen, kids won't eat the food. But it was done. More fruits, more vegetables, more whole grains, less sugar, no sugar-sweetened beverages, less salt. And you can see the power of a single policy to improve nutrition in school meals, and kids are eating the meals, and they're doing much better. Now, if you want to talk about disparities and equity, this is where the power of policy is really important as well. This is showing the food from grocery stores, nutrition equity, the consumption of healthy foods by income in the United States. And so focus on blue. Blue is poor nutrition, poor diet quality. Orange is intermediate diet quality. If you look at kids and at the top and at adults, in the highest income brackets of the United States, poverty income ratio greater than 3.5, over the last 20 years or so, the proportion of kids and adults who have poor diet quality has gone down, and the proportion who have intermediate diet quality has gone up. The proportion with ideal is pretty low, but at least intermediate has gone up and poor has gone down. And so we see a success, better diets, better nutrition in high income Americans. But disparities, look at middle income kids and low income kids, absolutely no improvement over this time period. In adults, there's a little bit of improvement in middle income and very little improvement in low income. And so our current policies are actually causing tremendous disparities and widening gaps in nutrition security for food consumed from grocery stores. Now, I just want to contrast that with kids. This is the same kind of graph, just looking at kids. Here, this is stratified by race, white, Black, and Hispanic kids. And here it's stratified by household income, low, middle, and high income. Look at what's happened for nutrition equity for food from schools after 2010, after the Healthy Hunger Free Kids Act. After the Healthy Hunger Free Kids Act, nutritional quality improved, poor quality diets went down, intermediate quality diets went up for every child in America, for all races, for all incomes. And so again, it shows the power of effective policy for improving nutrition in the United States. Now, there are other problems in the United States. Just fixing school meals is not enough. Look at junk food intake. In the United States, among children, about 18% of all calories come from junk food. And it highlights, again, the really severe diseases we're seeing in young kids. And what's interesting here is Mexican American children actually have the lowest rates, because I think of the more traditional foods that are consumed, and white and non-Hispanic white and non-Hispanic Black kids have the highest rates. And similarly, if you look at junk food by education, there's actually not a strong gradient here. All by parental, this is by parental education. Regardless of a parent's education, kids are exposed to so much junk food. And so we have to figure out how to address nutrition security by reducing junk food consumption among kids in the United States. If you look at ultra-processed food, which is a different way of looking at food and health, ultra-processed foods are foods that are highly processed and packaged and have been associated with a range of health harms. The percentage energy from ultra-processed foods among US children, this is US children, also true for adults over 20 years, has been going up, getting worse. And it's been getting worse most for non-Hispanic Black children, where now almost 75%, 3 in 4 calories among non-Hispanic Black children are from ultra-processed foods. And again, interestingly, this is not a poverty issue. There's almost no difference by family income. And so this is an issue of marketing and knowledge and cost and price and all kinds of things that make ultra-processed foods easier to consume and kind of the default choice for many children in the United States. Now, there is no accepted measure, but we are working and others are working on trying to understand how you might screen for nutrition security to start. And this is questions developed by Tufts, Kaiser Permanente, and the LA County Department of Public Health that we're now actually piloting. So a 2-question screener. First, thinking about the last 12 months, how hard was it for you or your household to regularly obtain and eat healthy foods? And there's a preamble sort of defining kind of healthy foods, fruits, vegetables, whole grains, and so on. And the person can answer anywhere from very hard to not hard at all. And then a follow-up question, a little bit longer, is people have different reasons for eating or not eating healthy foods. Please consider which, if any, of the following reasons were true for you or your household in the last 12 months, often true, sometimes true, or never true. And it goes through cost, stores, access, cultural preference, familial preference, inability to qualify for food assistance programs, lack of cooking equipment or time for shopping or cooking. There's all kinds of reasons beyond money that people are unable to get healthy foods. And so we think this is a way to start trying to understand why there's such high rates of nutrition insecurity in the United States. And so if we want to fix this, it was interesting that, Dr. Gunderson thought that nutrition security is somehow just related to SNAP. I don't see that at all. I see that we have to improve nutrition security through a whole of government approach to reimagine our entire food system. We have to leverage the federal nutrition programs to help improve nutrition, schools, SNAP, and WIC. We have to use food as medicine in healthcare, produce prescription programs, medically tailored meals, and more. We have to advance science and innovation, a new National Institute of Nutrition at NIH, ensuring that USDA research is always at the intersection of sustainability and nutrition. We have to leverage FDA standards and excise taxes on things like salt, sugar, and sugary beverages. We have to leverage our public health infrastructure, the power of the CDC, the dietary guidelines, the dietary reference intakes, NHANES, and surveillance. We have to catalyze the private sector. The private sector is not the enemy here. We need the private sector, from farms to restaurants to retailers to the supply chain to food manufacturers, to make healthier foods, and we have to reward them when they do, and potentially use sticks when they don't. And we can use ESG investing metrics, tax policy, B Corporation status. There's a lot of things to do to catalyze the private sector. The same way we've catalyzed the private sector for green energy over the last 20 years, we have to catalyze the food sector for nutrition security in the next 20 years. And we need overall coordination of our federal food and nutrition policy. And the US Government Accountability Office put out a report last year highlighting this. And we've proposed the need for a new office of a National Director of Food and Nutrition. How are we going to do all this? Well, one terrific way would be a White House Conference on Food, Nutrition, Hunger, and Health. Jean Mayer in 1969 led the last and only White House Conference on Food, Nutrition, and Health, with President Nixon and Senators George McGovern and Bob Dole. Jean Mayer went on to found our school, and I'm the Jean Mayer professor. So I take his legacy very seriously. His work led to the national expansion of SNAP. His work led to the national expansion of school lunch. His work led to the creation of WIC. His work led to the creation of school breakfast. His work led to all of the programs we have today that aim to address food insecurity. And now today, we need to use a new White House conference to address not only food security, to finish the work that Jean Mayer started, but also address nutrition insecurity. And we're really delighted that in the FY22 appropriations bill that just passed, there's $2.5 million for the White House to convene a whole of government conference and develop a roadmap to end hunger, improve nutrition, and reduce diet-related illness by 2030. So thank you so much for having me to speak, and look forward to Q&A.
Great. Thank you both so much for sharing your work and your perspectives. I have a few questions here that I'll go ahead and read off, and I think we can go from there. Okay, so the first question is from Danielle Conlin. She says, I agree with the importance of giving all people autonomy and dignity, especially when it comes to food. But I also think that it's important to improve access and intake of healthier options. What are your thoughts on options besides restricting SNAP eligible options, such as policies implementing taxes on less healthy foods or subsidies on healthier foods to help SNAP benefits go farther for healthier foods and improve nutrition security without shaming or severely restricting people's choices and affecting their autonomy?
So I guess I'll speak a little bit to that, and then Dari can. I'm vehemently against, just like I stand in solidarity with the anti-hunger community, which has spoken out against restrictions on SNAP. So I appreciate the fact that this question is prefaced with the fact that we don't want to condescend and patronize and shame low-income individuals by telling them what they can and can't eat. All these other proposals that are being done in terms of taxes, I think, depending upon how they're implemented, where they're implemented and things like this are great. I think that one of the main advantages to having SNAP increased by 20% was, it increased the ability of people to purchase healthy foods. I mean, as Dari showed in his slides, is if you have more money, you can purchase healthier foods. We see it again. Same with low-income individuals. You gave them more money with SNAP, we're going to see improvements in nutrition. Absolutely, we're going to see that. That's the beauty of SNAP. One thing I do want to really state, though, is that access to healthy foods really is not an issue. I mean, you can't, 80% of the SNAP dollars are being spent at large supermarkets or large scale supermarkets, another 10% at smaller places. So in other words, those are places with healthy foods. And so we can't make the claim that people aren't at locations where they can't purchase this. Yes, it's harder for some people. Yes, it is. I no doubt about that. I'm not meaning to say every single American has access to safe and healthy foods, but we know for a fact that virtually everybody does, including low-income households. So we really need to emphasize that in our discussions. And if we don't emphasize that in our discussions, we're going to be going on the wrong paths.
So yeah, I would say that Americans have physical access to healthy foods in most places, but there's so many barriers to buying, purchasing, cooking, preparing, storing healthy foods. My family, we're married, nuclear family. We have every luxury of education, income, where we live. It's still really hard to go to the grocery store, get fresh food, cook, plan. So there's lots and lots of barriers: cost, time, effort. We really need to have convenient packaged and processed foods that are actually healthy. We need to have, healthier foods cost less than unhealthy foods, and do many other things. So I think access doesn't just mean physical access. There's time cost, opportunity cost, education, availability of a kitchen. Many Americans, low-income Americans, don't even have kept kitchens. They have a microwave. And so I think there's a lot of issues beyond sort of the availability of supermarkets. I agree completely with Dr. Gunderson that the food desert, explanation for poor nutrition is not supported by the evidence. Now, there's a lot of controversy about restricting SNAP. I personally have not ever called for restricting SNAP, and I don't think that it's the best choice. So I would agree with that. But I will say that there's plenty of research and people who think it's not unreasonable. Polls have been done, surveys have been done of SNAP recipients, and somewhere between 50 and 70% of SNAP recipients themselves believe that SNAP shouldn't pay for sugar or sweetened beverages. So that's interesting that when we ask SNAP participants themselves, dignity and autonomy, they don't think SNAP should pay for sugary beverages. We have nutrition standards for WIC. It's a terrific program. It's a fantastic program. We have nutrition standards for school lunch. So having nutrition standards for SNAP is not necessarily a bad thing. That being said, I think it's politically challenging. I think the anti-hunger community is dead set against it. So even if it would make sense, I don't think it's politically that viable. So I think rather than trying to push and put all our eggs in that basket and fight, have nutrition and anti-hunger and public health folks fight and ruin all of our goodwill together, we should get together and think of other ways to do this. And so one way is an incentive-disincentive program where folks who buy healthier foods get 30 cents more for their dollar. And if you buy, soda, and not just soda, maybe candy and junk food, you get 30 cents less for your dollar. And so, yeah, benefits go down per dollar if you buy unhealthy foods, but they go up if you buy healthy foods. We could call that SNAP Plus. We publish on this. We can make it optional. It's opt-in. If you're on SNAP, you can opt in to SNAP Plus, so you can choose to go and buy healthier things. And you preserve choice, but you get more for your dollar if you buy healthy foods, and you get less for your dollar if you buy junk foods. We've done analysis of this. It would save money and improve health. And so I think that this is something that could be considered. But more importantly, there's so much to do outside SNAP. We have to leverage HHS. We have to leverage Medicare and Medicaid. We have to leverage the power of the private sector. We have to leverage the power of NIH and nutrition science. We have to leverage the CDC and the FDA. So I think if a discussion about nutrition and food security is just about SNAP, SNAP is a pretty minor overall cog in the wheel of what we need to do to fix nutrition.
Great, thank you both. There's a question about school meals. They've gotten more nutritious since the Healthy Hunger Free Kids Act. That's true, but how to address the middle and high school student drop-off and participating in school breakfast and lunch? What are they eating instead of school meals? What policies can be put in place to improve diet?
Well, I can jump in first, then maybe Craig can jump in second. And this also gets to Margin's question, which is next. There's actually been very good study of this by USDA and by independent research groups, and participation and consumption, looking at plate waste studies of school meals, has not gone down as quality has gone up. And so while there may be anecdotal experiences for sure, overall, if you look across the research, as school meal quality has improved, consumption has not gone down. And so that's been really, really important to see and important to show. But for sure, lots of kids don't have school meals, and I think middle and high school students in particular are eating less. I think universal school meals are an interesting idea, and I'm on a bipartisan policy center task force, and we have an op-ed coming out in the New England Journal of Medicine where we call for universal school meals. I think there's benefits to that for reducing stigma, reducing other barriers that could help. But I think we need to improve the quality of the meals, improve their taste and improve their nutrition, and we'll get more kids to eat them. And that means investing more in the school meals. And I think if we have to stop thinking about school meals and SNAP and WIC and as sort of welfare or handouts, we have to start thinking about them as investments in health that return dollars back and lower healthcare spending. And so our work at Tufts, we really try to focus on economic analyses to make the economic case. And so I think that's really important. And there was an analysis that I advised that the Rockefeller Foundation published just a few months ago, showing that if you increase the nutritional quality of school meals, you get a return on your dollar in later health. So you actually don't spend, you actually save money. And so I think it's universal school meals and actually spending more on school meals so that they're tastier and more attractive for kids.
I just wanted to respond, just a couple of things. No, absolutely, SNAP is not part of the entire solution. When it comes to food insecurity, it's a large portion of it. And this is why I keep emphasizing SNAP. Nutrition security is a completely separate thing. I just want to make one comment. And WIC is great. I mean, it says near universal participation because of infant formula. I mean, amongst infants, it's hugely popular because you got infant formula. That's why it's so popular. Amongst 4-year-olds, participation rates are about 10 to 15%. Is that the participation rates fall dramatically in part because the kids don't like the food. I mean, and like I said, in some ways it's culturally insensitive. For example, you can't buy white rice with WIC, you can only buy brown rice. Well, that's kind of insulting to a lot of large segments of the population. The other problem with WIC, though, is that every 3 months or whatever it is now, people have to go in for instruction and things. I mean, all these things are making it more harder for people. So I think WIC is great over many dimensions. It's great that we provide infant formula to so many vulnerable households, but I don't think it should be used as a model for SNAP or for other programs. And I know you weren't saying that, but I just wanted to have discussion of WIC. It's a completely different program, which is with its own strengths and weaknesses. Yeah, in terms of school meals, I think that we have to think about this. Is it when kids get older, how, as they're able to make more choices, do they want some of these meals or don't they want, or will they go to other things? And the final comment I want to make is that Eric Rim is a friend of mine. I like Eric. He's a great guy. He and I disagree on a lot of different stuff. And I've told him this, that study that you cited that say 60 to 70% of SNAP recipients said they would like, that was a small scale study. It was not a nationally representative study. It was a small group of SNAP recipients in one particular location and the way the question was framed. So in other words, it's useful information, but it's not a definitive statement about whether or not SNAP recipients want that.
There have been about five papers in different regions of the United States asking this question, and all have found sort of 50 to 70%, not just one paper. So we can share those references, but there's a lot of different papers that have looked at that question. Yeah.
Thank you both for sharing. I have one question/comment. So Tufts is working with USDA to support research to examine updates potentially needed in the food insecurity measure. Dr. Mozaffarian, can you talk a little bit more about the idea of not only nutrition security measurement, but also the potential updates and changes to the food insecurity measurement?
Yeah, so the U.S. Preventative Services Task Force just put out a call for research questions around addressing food security, and we responded to that in a letter. And the points we made were some of the same points that I made. I think that there's been huge benefits of the food security measurement, but it can be improved. And so separately from nutrition security, I think we need to understand and address when food insecurity is a problem of calories and when it's a problem of type of food. Too often I hear the anti-hunger community talk about hunger and mix that with food insecurity. And as I showed you, the very low food insecurity is really what the USDA has considered hunger, not food insecurity. So I think we have to much more clearly define availability of food and calories versus type and quality. I think secondly, we have to really define the period of risk and the duration of risk. I think that's really important. There's got to be a difference between families who are food insecure 20 days a month for 9 months a year versus families food insecure for 3 days the whole year. And yet in the current national measures and the current surveillance and the current things that are reported, that isn't often differentiated. And so I think that's another really important thing that should be differentiated. And lastly, I do think officially, if you look at the official definition of food security originally, it should be nutrition, and that's not measured. And so I think somehow we have to incorporate nutrition.
Right. I mean, it was designed to address food insecurity, full stop. And so this is what it's designed to do. There actually has been quite a bit of work done trying to use the food insecurity measure to get at duration along the lines that you mentioned. It can't get at the lines of, for example, 20 days versus 19 days, but we can get some very broad statements about how many months of the year this occurs. We can get some very good information about the number of days per month. And so there is a lot of work that has been done on that, because you can leverage the fact that it's an annual measure and the 30-day measure to get some of these issues. So there's been quite a bit of work done along those lines.
Great, thank you. And I think this is our final question, unless we have time for one more, but I think this might be it. So the first time I heard the term nutrition security, it was from Leia's Pantry, who included the tagline, of "I'm nourished, I'm seen, I'm heard, I matter." This is part of their trauma-informed nutrition work. How is this, quote, new definition of nutrition security not another example of a term that has been hijacked, or that had a social justice meaning being hijacked, co-opted, medicalized, and used to disempower communities? Also, how will communities that are most at risk for being poor or for having poor outcomes in a current system being actively engaged in efforts to define any new terms and actions?
Well, I think for the first point of as has been mentioned, I think this is a newer concept that we're going to need some time to define and find metrics that work. I think it's critical to include people with diverse lived experiences in that work. I think that's very important. With the hopefully soon to be officially announced White House conference coming up, which again by the appropriations should be this year, I think that provides an opportunity to have convenings, and Tufts is going to organize a series of convenings. We hope to organize national convenings in many different places, and be sure that includes not just experts from experts. This is Dr. Gunderson used air quotes a lot. I'll use air quotes when I say experts, but also people with lived experiences. I think that's really important. And so so I think it's an excellent question by Julie. I don't have an answer other than to say I agree with her, and this all of us have to work together on this.
Great, thank you. Dr. Gunderson, do you want to add to that, or?
Since I'm not the one proposing nutrition security, I figured best be satisfied.
Okay. Sure. Well, thank you both so much. I think we're at time, and I want to be cognizant of everyone's time. I think now, Dina, I believe, will discuss sort of our next step. We're going to take a little bit of a break, have a few announcements, and then reconvene in a breakout session. But thank you both again so much for sharing your expertise, your perspectives. We really appreciate you being here with us today.
Thank you. See you later.
Thanks. Actually, Megan, I would say we will have announcements at the next break. We want to talk a little bit about our I plus PSC course again for those who weren't with us yesterday. So if we want to take a brief break right now, we're actually a little bit over time. So why don't we take, let's see, I'm looking for my other page. Sorry. You have the agenda in front of you. Why don't we take 5 minutes for people to get up, walk around, stretch, and we'll come back at 2:10. It's actually 8 minutes. What do you say?
Sounds great. And we're coming back to this Zoom link.
Yes, we're staying here. This is your breakout sessions, right? That you
Oh, right. Yeah. Sorry. I was thinking about the next one.
No. So, I mean, and
We're
if you wanted, you can do the breakout sessions right now. I mean, it's
No, let's
actually
take a little bit of a break just to.
Yeah. Okay.
give
So
people
I'd
an
say
opportunity.
2:10 we'll come back. People can, like I said, mill about, and we will get the breakout rooms ready. And yeah, we'll do that. You'll explain what we're going to do, right?
Yeah, I'll explain before. Yep.
Okay.
Thank
So
you.
we'll just one quick question, not for everybody, but for the two of you. Will I be assigned to a breakout session then?
Yes,
Okay,
if you'd like to be.
I would like to talk to people more because I think that just if that's fine.
Yeah.
Absolutely. We will put a randomly with our 60-some people, you will get in a room.
Okay, I'll just stay on then. Okay.
Yeah, that's great.
first part of the session. And thank you, Dr. Gunderson, for staying on and being an expert for this discussion part as well. So we're using Jamboard for this session, which I realize maybe some of people haven't been able to use. Since we only have about 15 minutes in our small group breakout rooms, I felt like, you know, it was good to have a bunch of questions, but just to focus on one or two for the purposes of the small group breakout room might be what's feasible. So I've got them listed here in the chat, and you'll see they're also listed at the top of each Jamboard slide here. So you can sort of scroll through that and pick which ones you as a group would like to focus on. And then go ahead and designate a note taker among your group to be the one who sort of fills out this Jamboard. To fill it out, what I would do is use sticky notes. So you can click on a sticky note and just type in whatever you want to type, whatever themes are coming up or things that you're hearing are coming up. That's one way to do it. You can also use the text function to put a text box in as well. So there's a couple options for how to actually use it. So maybe pick the person who has the most technological skills and experience in the group, and I will be available as well. So if anybody has troubles, feel free to chat me. And with that, we'll go ahead and start to break out into our breakout rooms for our discussion session.
Megan, what time do people need to come back?
Oh, thank you. So in about 15 minutes, so that would be, was that 27 after?
27, okay.
Yeah.
I'll be watching, thanks.
Yes, thank you.
Okay, so I'll be opening the room. So once I've opened the room, you can just select to join it. Otherwise, you'll be automatically sent to the room. Thanks.
Recording in progress.
not different viewpoints, but they had kind of contradictory viewpoints a little bit. It's awesome.
Very much, yeah.
I was biting my fist when Craig, I believe, I can't remember his last name, but I think, so what we do in our program is I understand everything he's saying. I know that, you know, having autonomy when you go to the grocery store it just feels good. You know, having autonomy in life feels good. But, you know, what he kind of skipped over or failed to bring up was, you know, we try hard to get as much different foods on our program as possible that are culturally like, you know, appropriate, or, you know, we push the envelope with cultural foods. Like for fruits and veggies, I put salsa on the program. I put tomato sauce on the program. I bend the regulations to the point where I don't break them, but I'm like, I'm going to put as much on this program as possible. And then if I think it's something that maybe isn't as healthy, I'll train our staff of like, hey, let them know these options are available, but let them know, you know, go over the nutrition facts with them, go over the labels with them, you know, let them know. So I think if you're going to give autonomy is good, but I think even better is here's some guide rails, and here is nutritionists. I'll tell you how to look at nutrition. So I think that's the best way to do it. So that's what I got. That was my first thoughts.
In Utah, what does that look like?
So actually pretty similar. We're pretty liberal with the food and even formula that we allow for the WIC program. We definitely try to offer as much variety as we possibly can. And so it's kind of similar to what, I'm sorry, I missed your name, Frank was saying. I just had another thought though. One thing, like, so in the presentation, they're kind of talking about how, you know, WIC maybe has some weaknesses because there's some extra barriers, and families maybe don't want to participate on WIC because, you know, they have to come in every 3 months and they have to listen to this education, or they can only buy certain foods. And so those limits make it so that they don't want to participate, you know, after they're not getting formula or something like that. And I know there's a huge push right now to try and allow for more virtual appointments and to increase the WIC program to go until the child turns 6, and they can go and get school lunch after that. And so they don't have, and so the certification periods go, instead of for 1 year, they increase to 2 years, so that it relaxes some of those hardships, I guess. And I would love to see that kind of push in the WIC program, and just like in general for a lot of programs that provide nutrition or nutrition education, just make it more accessible in like a state plan or whatever, so that people will be more likely to participate, and then therefore hopefully reduce food or nutrition insecurity.
Miranda, are your appointments in person? Are they over the phone?
We kind of do a hybrid. It kind of depends on the area of the state. So I know that some areas in Utah, like more rural areas, they'll like do over the phone or virtual, but a lot of our areas are having people come back in. But during, like, you know, in 2020, we switched to completely virtual, or just people would drive up with their cars to pick up their WIC card, and we would just talk to them over the phone to do the
announcement from Sharice.
Okay, perfect. And that's at 45. Okay.
I'll
Or no,
look in
it's 30, 35.
I'll take a look, Megan.
Okay.
It's supposed to be 35, but you can go a teeny bit over.
Okay, sounds good. Perfect. Okay, are we all back now? Because I'm sharing my screen, I can't see the whole
There's
room.
50 people.
Yeah. Yes, there are 50 people, but the breakout rooms are closed, so they aren't open anymore. So
Oh, okay, perfect. Sounds good. Great. Well, thank you all for this very riveting discussion as I'm seeing on the Jamboard. I saw a lot of people, a lot of groups focused on this first question, so I thought that would be a great place to start. It looks like for a lot of states, we had some similarities with culturally relevant food, some issues with lack of transportation, especially in rural areas, and time. I'm wondering if any of the groups where those were common themes, if you could speak to some of the stories that you've experienced and your own work. I know we have a big Colorado contingency. So if anyone from one of those groups wants to speak, I also saw somebody from Oregon mentioned cultural relevance as well.
So in our group, and we had Arizona, Oregon, and Colorado, we're the 4 yellow Post-its at the bottom. A lot of our things were that our federal programs were not actually doing a lot in terms of addressing the cultural needs. A member of our group was talking more about, instead of food insecurity and food desert, talking about food sovereignty and making sure that our participants and the people in the areas that we are working with, that they actually may have access to the cultural foods. Or this is not something that I said in the group, but something that I thought about afterwards. SNAP Ed also talks about making sure that the foods are more in line with dietary guidelines, which could either be financially unable to be met, or it changes the taste, the appearance, the texture, and they don't want to do that. So, making sure that when we talk about being culturally sensitive and culturally appropriate, that we're actually not, okay, well, yeah, your fry bread is great, but you need to make it with wheat flour and olive oil, and then it changes it in terms of what's actually able to be addressed for our people. And one of the other things we talked about was making sure that we didn't have that silo approach, and making sure that it was truly a community, county, state approach, that we were addressing everyone and not just a one approach suits all type of a setting.
Great. And you said in the current programs, you don't feel like that's necessary, that the sort of cultural relevance is necessarily being addressed very well.
Not as well as it could be.
Mm-hmm. So this is sort of potentially an area where if nutrition security were to be better defined, we could add something in about cultural relevance, or thinking about making food insecurity more better defined, adding in things like that.
My personal opinion, yes.
Okay.
I don't want to speak for the rest of the group.
Yeah. Does anyone else from that group feel like they have other sort of points to contribute, or any of the other groups where this was a point of conversation?
Hi, this is Sarah from Nevada. I wasn't in that group, but cultural competency, culturally appropriate foods were a conversation in our group. And specifically, I know we had Ellen from Alaska on there saying that a lot of the fish or things that, the native Alaskans would be hunting or, being used to outsource and maybe go to other states or other areas. And then we see that in Nevada too, where we don't have a lot of ag, but what is being grown, it's more profitable for the farmers to sell to other states or restaurants, maybe out of that community.
Great. I know in Colorado, some of our community of food assistance, like the Food Bank of the Rockies, is trying to do a lot around culturally appropriate foods, like surveying clients and making sure that they have foods that they eat during, specific holidays even, or times of year, or even just certain communities that are like refugee communities and things like that. But it sounds like, there's such a wide variety of how we need to meet the needs of communities, and that it's so great that there's a focus on cultural relevance in so many different states. Let's see.
One of the things that we talked about was how SNAP is one of the benefits that there's no boundaries in the United States, whereas WIC is, you could only use it in your state. And if you are in a town that is close to a border and the closest grocery store is in another state, you can't use your benefits in that other state because you're a Colorado participant.
Right. Yeah. So sort of another layer to the transportation issue. Great. Does anyone want to talk a little bit more about seeing kind of WIC and SNAP work more closely together? That was an interesting point. Does the group who did that remember? Okay. We can move on to the next question. Okay, so I saw there were a lot of folks that talked about incorporating food insecurity and or nutrition security into their state plans. There were quite a few people that said that there's some programs that are already in place. So that was really interesting to see. Does anybody want to talk a little bit more about any of those programs that they have in their state and how they were implemented and that sort of thing? I see Utah, Arizona, Colorado, Hawaii. Lots of folks had programs already in place.
Yeah, I can speak to the sticky note on Utah. So in our last legislative session, a work group specifically to combat food insecurity was created. So now we have a budget. There's also a list of organizations and people who should be involved was included. So I believe that we have around 10 programs and people included. It includes WIC, SNAP, SNAP Ed. I don't think it includes extension, but it does include like our anti-hunger advocate. It includes like consumer groups like Utah Dairy Council, Utah Beef Council. So really working on collaborating and collaborations across programs that may not interact. For example, like WIC doesn't offer beef. So collaborating with the Beef Council isn't intuitive, but it's something that we're hoping we can all come together to improve food insecurity. And although it is specific to food insecurity in the legislature, when we had the group before, but it was like the State Nutrition Action Coalition, and now it's specifically been codified for food security. Because there's a lot of nutrition professionals, a lot of dietitians, and a lot of people who work with nutrition in it, just already, I do think that nutrition security will still be a focus, even though it's predominantly supposed to be about food security.
Great. Going forward, you do think that the nutrition, sort of some of these concepts that we're talking about with nutrition security are going to be implemented?
Yes, and nothing specifically has been said about that. So that's just kind of me, I guess, philosophizing maybe, that just because of the previous discussions we had in the group and because of the people who are involved, I could see nutrition security trying to bridge the gap that can kind of exist between food security and nutrition security.
Great. I guess I have a couple questions. I'm just curious if folks, when thinking about application, when thinking about just the issues that you're facing with in your states, did you feel that since nutrition security is such a new topic, it's still being defined? Do you find that is problematic when thinking about the actual application, or is there enough of sort of a general sense of support for that sort of work, or is there, I guess, in terms of application, are folks running into any issues because it's not as clearly defined as food insecurity with the application piece? Or is it just so new that people aren't even really officially doing anything yet, as Danielle, you pointed out in Utah? Thank you.
I mean, honestly, it's not new. Leah's Pantry had that in 2017. This is just a certain group of authors who put a new spin on it. So, I mean, that goes back to nutrition security is defined by whom and for what purpose, and incorporating which voices. So, I'll just put it that way, right? And who has the power? Who's saying that they're doing the convening, of what this is going to look like and who? And so, I mean, that's very telling. So I guess I don't know. I would say it's not that new. Only this version of it is new.
Sure.
And there's certainly conversation, right, in the community about that.
Yeah. Thank you for pointing that out. Yes, Monica.
Hi, that got me thinking about how nutrition security, I feel maybe more, as dietitians and nutrition professionals, it's something that we've heard of, and we kind of know what they're maybe trying to get out with nutrition security. But at least, for example, I work in a large organization that works to fight hunger through food banks, free meals, and those types of things, through dining rooms. And food insecurity seems to be a lot more popular term. And when food boxes or these meals are given to individuals in need, the focus is on making sure that they have enough food, not necessarily nutritious foods. It's more so food. And I find this can sometimes cause some problems, especially when I have patients that I'm seeing who have chronic conditions like diabetes, or maybe, liver cirrhosis or anything like that, when they're trying to get a food box. And what we discuss in our sessions might be very different than the food box I'm giving them, because we identified food insecurity. So while I think that as nutrition professionals, we kind of have an idea of what nutrition security might be working towards, more so like for the public and other organizations that might not have that background, food insecurity is still kind of in the front. And we kind of still need to bridge that gap to make sure that these individuals who are getting these services and have chronic diseases get access to nutritious foods.
Great, thank you. Is there anyone else or any other group that's dealing with similar issues in their own work? probably a lot of people. We could do a raise of hands, I bet. Great. Okay. I'm noticing the time. It's a 3:45 here, 2:45. Do you want to do the announcements, Dina, before the next session?
I guess, yeah, unless there's like some other things here you want to spend a few more minutes on, then we can just kind of mosey on over, because unfortunately we are going to another link. So I need to give people time to get off and get back on for those who are joining the sharing session. So I want to be cognizant of that as well.
Right. Yeah. And I'm happy to share the Jamboard as well. And obviously,
Can we post it on the NLN website? Is that possible?
yeah, you can use the link and post it. It's a living document. So if people want to continue adding to it, if they remember things after the fact, that would be great. It's a great opportunity to kind of hear, shared experiences and that kind of thing. So,
well, and the other thing too is that I see a couple of people joining here, which might be problematic, but we'll see. We have some abstracts around this topic, actually, so we might end up kind of bringing the topic into the sharing session. So I think it's kind of okay. Maybe we'll put a pin in it here. Sharice, are you available? Because if you are, then maybe we'll do a quick, we got a good audience here. We'll do a quick announcement on the I+PSC course, and then we'll kind of shift to the other link for after our sharing session, if that's okay.
Yes, I'm here, Tina.
Awesome. Okay, so are we going to do the video first, or
the video first would be good?
Okay, all right. And I'm just going to turn this over to Sharice. First of all, thank you, Megan and Barbara, for that great session on food insecurity and nutrition security. It seems like this is going to be an ongoing conversation. So very, very exciting stuff. And thank you for leading us through that. We're going to just do a quick announcement, and then we will shift to the sharing session link, which is a different link than what we're on right now. So hopefully people will rejoin. I'm going to turn it over to Sharice, and we're going to hear a little bit about our newest short course.
Hi, everyone. My name is Sharice Shelton, and I am an MCH trainee. I'm with the University of Hawaii at Manoa, and I will be sharing with you a sneak peek of a short course that will be available to you all shortly. And I just wanted to first note that I'm very grateful to be having this opportunity to work with Angie Tagto, Dina Herman, and Leslie Cunningham Sabo on the development of this short course. I apologize in advance. My camera is not working, so I unfortunately will have my video off for this time. I will start off by first sharing a promo video that Angie developed, and it provides an excellent overview of the short course. And then I'll be digging a little deeper and providing an overview with some visuals. So Dina, if you would like to share the video.
I think Chris is going to do that for us.
Oh, Chris, yes.
Hi, I'm Angie Tagto. I've had the privilege of working with the Western MCH Nutrition Leadership Network for the past few years. And what I've learned from you is that change is constant. The problems we experience are more complex than ever. And sometimes it just doesn't feel like we're keeping pace in meeting our community's needs. Well, in response, the Western MCH Nutrition Leadership Network will soon be launching a dynamic short course to support you, your team, and your organization to boost your confidence and capacity in addressing complex adaptive challenges. The short course uses the I+PSE conceptual framework for action as a roadmap, taking us on a journey through a series of recorded learning modules, engaging exercises, and loaded with resources to support your work. More information will be coming soon, and I look forward to you joining me so we can make the I+PSE conceptual framework work for you.
Okay, thank you, Kristen. And then if you could just bring up the slides. Okay, perfect. Okay, so yeah, I'll just be diving a little deeper into this short course and what's included. So you can go to the next slide. Okay, so I'd first like to acknowledge that this course was supported in part by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. So the aim of this short course is to provide individuals, teams, and organizations with a roadmap and many tools that can help strengthen leadership and capacity to better address the wide array of adaptive challenges, or also known as complex problems that we face today. The format of this course will be 100% online with digital readings, worksheets, and recorded videos. And the audience is quite diverse, so it's really for any MCH public health partners, but it has been specifically developed for MCH nutritionists that are part of the Nutrition Leadership Network. And students are also welcomed and highly encouraged to take the course as well. Next. So the short course is informed by the Individual Plus Policy, Systems, and Environment, also known as I plus PSC, Conceptual Framework for Action. Angie, Dina, and Leslie published an excellent paper on this framework, and the citation for the paper is on the bottom of the slide if you're interested in learning more. These slides will also be available on the website, so you'll be able to access it. Overall, this framework serves as an excellent roadmap for leaders such as yourselves. This course will carefully guide you through the steps of using this framework so that you can take a systems approach to addressing complex problems. This will involve identifying the root causes of complex problems and then developing multi-dimensional strategies that work together and produce more sustainable solutions. And then exploring how can we evaluate impacts on these many different levels. Next. So the course is divided into a series of these 5 modules, and they have curated content that will leave you feeling very confident in your ability to operationalize the I plus PSC framework in your own work by the end of the course. So aside from the great depth of knowledge that you will obtain from this course, you will also receive an abundance of resources such as a syllabus to help guide you through the course, a workbook with many different activities and case studies that will really give you the opportunity to start applying the learned content to your own work, a reading library, and access to the recordings. And all of these you can return to at any time, even after the course. Additionally, we are working on ensuring that continuing professional education units will be provided upon course completion. Next. Okay, so now you may be wondering, is this course for me? And we think yes, it is. If you are here today, we think that this course will be great for you. If you're concerned about the time that you have available to take this course, know that this course has a flexible and convenient format that allows you to return to the course at any time. Additionally, if it is more convenient and beneficial to make this team effort, you can complete the course as a team with other MCH practitioners that you work with. The I plus PSC framework is also highly adaptable and can be conveniently tailored to any nutrition or public health challenge, as well as to any area of dietetic practice, including education and training, research, practice, and policy. And now, with the abundance of resources and research available, I think we can all agree that it's really difficult to keep up. And with the wide array of complex problems that we are challenged to address each and every day, it is especially urgent that we are equipped with the latest evidence-based tools and knowledge to confidently and efficiently approach these challenges. So this course provides very timely information and tools that can help you achieve greater impact in your current or future work. And by the end of this course, you will have developed an action plan that you can use to help guide you in addressing the adaptive challenge of your choosing. Lastly, if cost is a concern, we are glad to share that this course will be free for MCH public health partners. And as previously mentioned, it will likely be an opportunity to receive CPUs as well. Next. So that just about wraps up the main details of the course. If you are interested, please keep an eye out for further details that will be shared via email and also social media such as Instagram page and LinkedIn. If you have any further questions about the course, you can also send an email to the UCLA NLN Partners at gmail.com email below. And the course will be posted soon on the MCH Nutrition Partners website as well. Thank you everyone for your time and interest in this course, and I hope you all enjoy the rest of our meeting and this time together. Thank you.
Great. All right. Well, thank you so much, Charisse, and thank you again, Barbara and Megan. And we are going to actually shift gears. I know a lot of you are on right now, but we're going to shift gears and go to the sharing session, which is on a different link. I'm sorry. You guys have to get off and get back on, but I do hope that you join. So we'll end here for now and look forward to seeing you in a few minutes. Leslie Cunningham-Sable will take us into that sharing session, and we look forward to discussing more what you're doing. So see you in just a few minutes. Bye-bye.
large hotel room. We've all had we have our glass of wine, not this water, or a beer with us, and we're all together enjoying some lovely appetizers and really engaging with each other, sharing with each other kind of what's happening in our states and challenges, successes we've had. It's one of the most meaningful parts of our session. So just channel that with me, and we'll have fun together. I want to introduce Caitlin Havener and Michaela Harvey, who are my awesome MCH trainees, and I'm really jealous because they're sitting outside in the sun and they've got their sunglasses on. So they're just going to help kind of monitor the chat, and we have a number of abstracts submitted, and I want to start with abstracts submitted from our state partners. And then we'll give you each about 5 minutes, and either Caitlin or Michaela will give you a 1-minute warning. And then we'll have time for a question or two for each. And then after we've gone through the states, and I want to make sure, Dina, that we have time for this, but if there's folks who did not submit an abstract, but who have something they want to share, maybe raise your hand and or shout out loud, because I won't be paying attention, that you'd like to go and talk, that would be great. Then we also have some abstracts from our trainees as well. And if we have time, I'd love to be able to have them present on their research as well. And at the very end, if we have time and people are enthusiastic, I'll share with you a little bit about a review article that we wrote using the I+PSE framework for action to determine how healthy eating, active living PSE initiatives were evaluated, or how they evaluated them, and where some gaps in evaluation might be that are really important to discuss. If not, that's okay. But why don't we go ahead and get started? Dina, have I forgotten something?
No, just for people who didn't write an abstract, they should still, jump in if they're interested in sharing. We don't have to have that formality necessarily.
Great, thank you. So I'm just going to start. So if we put in the link to our website, and at the bottom of that page is the section called 2022 NLN Documents and Resources. And there are a number of different kinds of resources there that you already have, the agenda, some slides from other presentations, but embedded in that are abstracts from those of you who've submitted them. So I'm going to go in order there and just focus on the state partners first, and then the students. And if I've forgotten anyone, just again, raise your hand, make yourself known, and we'd love to hear from you. So I'm going to start with Montana and the WIC needs assessment. So if you are free, you can pull that one up. And then let's see, who is our presenter for the Montana WIC?
Has to be Lacey.
Hey, Lacey.
Hey, I'm never usually first. You threw me off. All right.
Sorry.
Well, it's good afternoon, I guess, for everybody. I'm Lacey Little. I'm the nutrition coordinator and one of the dietitians at the state WIC program in Montana. So one of the things that we have been very busy with over the past year is a needs assessment. This is something that's never been done in our state since we've had this contract. And so for about a year, actually a little bit more, we've been working on this with a contractor. Their name is Yarrow, and they are specifically a public health initiative contractor. They're fairly new in our area. And they have been collecting our data and then data from secondary sources, CDC, General Montana information, and have put together a very, very cool assessment that we are all very proud of. It's ended up being 73 pages of background and analyzing of our program. It's, covers demographics on staffing patterns, participation, basic demographics. Then it goes into about participation, how long people are participating for, what are some barriers or, thought of to be barriers. And then we talk about like breastfeeding rates and a lot of breastfeeding information, how we can, access the breastfeeding support in our area. and then also about nutrition, health indicators, and different parts of what we offer in the WIC program and what's valued with participants versus what we think is being perceived as valued. So this whole assessment came together in order for us to better support our Montana communities and get more people to continue to stay on the program and use our benefits. As most people know, if you're in WIC, you know, everything's been declining in participation numbers. And so that's kind of where this has all stemmed from the last few years is what are we doing or what can we improve on to continue to get our services to be used. And so this assessment is being used to come up with a state comprehensive nutrition and breastfeeding plan. And then once we create this state comprehensive plan, we are having all of our locals create their own sub plans that supports the state plan. So we're hoping with all of these pieces that come into place that we will be able to have common ground, common goals, and address the state as a whole, because we are very, very rural, as most people may know about Montana. We have 29 agencies and about 84 clinics. So our Montana program really does cover all of our counties, but you know, the closest WIC clinic could be an hour drive for somebody. So we're just hoping that this assessment will give us more of a guide we have a quality improvement group it consists of state members or state staff and our local agency staff. And so using this, we're hoping to do more direct kind of quality improvement for our program. I think that was my 5-minute limit.
Great. Who's got some questions for Lacey?
So yeah, Amy shared our link to our assessment. Thanks, Amy. It is posted on the Montana WIC webpage. So if you want to look into it more, if you're interested in it, there's some pretty cool graphics. If you were a part or listened to the sharing sessions a few years ago, we talked about rebranding. And so a lot of our rebranding stuff is in this needs assessment. So yeah, she shared that link, which is great. Thanks, Amy.
What a great resource.
Yeah, you guys have done some amazing communications campaigns too, right, Lacey?
Yeah, we've been doing a lot of different communication campaigns, mostly geared around like the increased fruit and vegetable vouchers, which is probably what most people are doing. And that's been really successful. And a lot of that's been going through Yarrow as well, our contractor. They have stepped up when we've lost a lot of staff. And so they've been a phenomenal partner to be working with in public health for sure.
Great, thank you. All right, I think next we have Oregon. So that's got to be Robin Stanton, right? Is Robin with us?
I don't know if Robin
Yes,
is.
I am. Sorry. Hitting all the wrong buttons.
There she is.
Video. Okay, great. Thank you. All right. So I'm Robin, and I'm with the Oregon Public Health Division Maternal Child Health Program, and funded 100% through Title V. And so I'm involved with our Title V block grant. I'm making an assumption that probably most, but maybe not all of you are familiar with what Title V is. You know, it's a federally administered program and all states have this. And so basically we're in our second Title V cycle. So this is an evaluation of the previous 5 years. And so I first want to say that funding for this project is from Association of State Public Health Nutritionists, ASPHN, through the Children's Healthy Weight Grant, building nutrition capacity. And so what you're seeing actually is just a sneak first preview, because I just got the draft report from the evaluator about 2 weeks ago. And we're still in process of revising and going through the report and getting back to the evaluator. So through this grant, we were able to hire an evaluator,
And in Oregon, the two priorities that I have been lead for have been breastfeeding, which is federally is one of the federal priorities, and then food security, which has been our state defined priority. And I think Oregon was the only state that had selected identified food security during the first 5-year cycle. I think now that has changed in this second 5-year cycle. So what I set out to do is I really wanted to know, to do a program evaluation. We haven't ever done that. We have metrics that we're required to report. So quantitative data that we report to in our federal grant. And then in our with our local agencies, they report metrics to the state. And I do want to pause and just say that, and for those of you who aren't familiar with Title V, so we have federal guidance on what you're supposed to do, but states can implement the program with a lot of flexibility. States are all very, very different. And so in Oregon, we pass most of our Title V money to our local public health agencies and tribes who, federally recognized tribes who choose to participate in the program. And then they have a lot of autonomy. So we do provide a menu of options on what they can choose to work on. And breastfeeding has been one of the top priorities over the past 5 years. So in my abstract, I don't have information about the quantity or some of the description on that, but that is in my full evaluation report. And so basically, when every year the local agencies have to submit a report back to us. And so like as the lead for breastfeeding and food security, I review the reports and they all submit qualitative information. So in addition to metrics, which they may or may not meet, and I will say the metrics are locally defined based on what their needs are. So there's not necessarily a match of metrics across agencies in the state. We're trying to improve that, but again, it's really for their own program and program improvement. So the evaluator looked at all this qualitative data over 5 years, and that was in narrative form. And yeah, go ahead. A question? Oh. And so,
sorry, I was just saying.
Go ahead. No, maybe it wasn't for me. And so basically what the results were is, the activities were either fully successful, partially successful, like mixed success and some barriers, or barriers. And so we found that overall, most of the grantees were successful with their food insecurity activities and mostly successful with breastfeeding activities. There were some themes that emerged from the evaluation.
Hi, Robin. Just so you know, we're at the 5-minute mark. We had some technical difficulties. So you can go ahead and just wrap up with 1 minute and then we'll just cut questions a little bit short.
Okay, that's fine. So
sorry about that.
Done. Just the themes are that the year-to-year consistency was really important, and if they had institutional support in their program and from their supervisor or partnerships, and then that there are limitations to the quantitative measures. And then the barriers were staff turnover, lack of leadership, their data systems, communication across programs, and just choosing different activities year to year to year. And so that I will close there. So thanks.
All right, thank you, Robin. Does anyone have a quick question for Robin? It's really exciting.
I see Dina put some links to some things in the chat. Looks like the Title V performance measures. And I don't know exactly what the second link is. Maybe if you want to expand on that, but
it's for the state application or annual report. So Robin was referring to the evaluation, which I believe is part of the assessment. Robin, is that correct, or is that something else? So you're evaluating from 5 years before?
We're evaluating 2016 to 2020. And this is Oregon only local evaluation, not state evaluation. And so
Got it.
But it's exciting to have some qualitative data along with the metrics, as you said. That's really awesome to share the story. All
And
right, thank you.
Robin, just one question. So, because we had this conversation just now on food security and nutrition security, how is Oregon proceeding?
I'm not sure about answering that in this time available.
Maybe if we have time at the end, or this could be a happy hour topic. What do you
Probably
think about
should be,
that?
yeah. Okay.
And we probably all enjoy a glass of wine while we talk about this. All right, well, Chris Mornick from Washington State is up next. And that'll be listed as NLN 2022 abstract, Chris Mornick, Washington, strengthening statewide and multi-state work on farm to early early care and education.
Thanks, Leslie. Can everyone hear me okay? Okay, I was having some audio issues. And if you hear a little noises in the background, it's just my 2-month-old who's hanging out right now, listening and learning. It's good to see everybody. I am technically still on maternity leave, and I did write this abstract when I was about 2 weeks postpartum. So I'm not sure I even remember what I put in it, but I think what I was doing was highlighting some of our farm to ECE work that we've been doing in Washington. And for those that aren't familiar, farm to early care and education is essentially similar to farm to school, but with a focus on childcare. So the prioritization there is you're integrating some sort of hands-on gardening experience, whether that be raised garden beds, in-ground gardens, or even just pots in the classroom. You're doing, some sort of local food integration into menus and snacks and taste tests if possible. And then there's the experiential education component, which is things like reading books about fruits and vegetables, using beans for counting, integrating fruits and vegetables into other classroom activities, doing a farm visit, having a farmer read a story in the classroom, that sort of thing. So Washington has been extremely fortunate in that we are the recipient of the Farm to ECE implementation grant, along with, I think, 11 other states and DC. And we, on the first year of that grant, really focused on building a statewide Farm to ECE alliance, increasing membership in a community of practice, which is open to any member of the public that's interested in Farm to ECE, focusing on diversity, equity, and inclusion, integrating Farm to ECE into the Child and Adult Care Food Program, or CAFP, and then developing some additional online training modules and translating those into Spanish. When we received the continuation grant for the next year, which we're in now, we decided to focus on a couple other things. So one of them was really increasing equity through access. So we are translating about like 18 or 19 different materials. Some of them aren't even ours. We had a budget big enough that we just reached out to other partners who had developed materials and said, hey, can we translate this for you? So we're going to be developing a Spanish language page on our website, which I'm really excited about. We also have already added a tribal resource page. We've been doing a lot of connections with tribal organizations in Washington, supporting traditional foods in early learning, and that has been just incredibly informative and enriching work. And then we decided to step out of the box a little bit and see if we could collaborate with Oregon, which I don't even know if Robin knows we're doing this. she's not in the farm to ECE.
I don't.
Oh yeah. So we decided, it was inspired by the latest farm to school grants from the USDA, where they allowed multi-state applications. And we said, why don't we try to do something with Oregon? They're a great partner. We have, a lot of programs and farms on the border of each state, and let's see what we can do. So we reached out both to their Oregon Farm to School and School Garden Network, as well as EcoTrust, who runs their Farm to ECE work, and just started having some conversations. And now EcoTrust is a part of our Washington Farm to ECE Alliance. So they come to our monthly meetings. We applied jointly to a farm to school and ECE training institute in order to put on farm to school and farm to ECE institutes in our own state, but we did a joint state application and we got it. So we're going to be attending that. What's that?
Just 1 minute left.
Oh, okay. Yeah. We're going to be attending that training together. And then we are planning on doing multi-state institutes. So developing some farm to ECE and farm to school institutes that we can hold in both Oregon and Washington to try to just sort of continue collaboration, share resources, and increase reach. That's pretty much it, I think. So yeah, thanks everyone.
It's really exciting. I love the multi-state collaboration. Anyone have questions for Chris?
Hey, Chris, it's Robin. I want the connection of the people you're connecting with, the names, just offline. Yeah.
Okay, sure. Yeah, I'll put them in the chat box. I'll send you a private chat.
Perfect.
Great, thank you. All right, our next presenter is from Nevada and about promotion of nutrition security. Talk about a hot topic. I'm not sure who's presenting there.
Hi. Hi, I'm Sarah Rogers. I'm the Nutrition Unit Manager with the Nevada Division of Public and Behavioral Health. Our nutrition unit at the division consists of our WIC program, SNAP Ed, the chronic disease program, and within our chronic disease program encompasses our Office of Food Security, which are the recipients of the grant that I'll be talking about. So Nevada, and I chose this grant specifically because it's new and only 9 states have it right now, so that'd be interesting. And I believe Oregon is a recipient of this grant. I'm not sure if any other states on this call are, but it's the SPINE grant, or the State Partnership Improving Nutrition Equity. So our Office of Food Security applied for and received this grant through the National Association of Chronic Disease Directors, and we are going to be partnering with the Catholic Charities of Northern Nevada to implement this grant. And we chose Catholic Charities based off of the fact that they serve 13 of our 17 counties, and 12 out of those 13 counties are considered rural or frontier. So they have a lot of great subject matter expertise and involvement within these communities, and there's a lot of established trust there. So the SPINE program promotes equitable and sustainable food and nutrition security. The National Association of Chronic Disease Directors is supporting state health departments in addressing food and nutrition security through sustainable and equitable actions that tackle economic and social conditions limiting food and nutrition security. So health equity is foundational to the SPINE program and will be integrated throughout our planning, action and evaluation phase for this project. We'll also be considering the impact of the COVID-19 pandemic as well throughout. So some of the goals of our SPINE project are to strengthen our existing partnership with Catholic Charities of Northern Nevada, and then also reach out and obtain partnerships through some of the other community partners and programs that they work closely with, and the community members that they work closely with. We'll be analyzing service areas and identify service deserts and culturally relevant community food needs. And we want to enhance current food and meal programs and offer culturally competent, fresh, and nutritious meals, and host at least one client choice event in a rural or frontier county with access to community health workers and SNAP case management. So the Client Choice Pantry is a mobile pantry that Catholic Charities of Northern Nevada already does in a lot of these rural and frontier areas. So we're going to help them do more and use this pantry to access more frontier areas than they currently do. They will conduct in-person client assessments and follow up with any wellness or homeless prevention services, including immigration aid. Part of SPINE is also developing a state action plan. So we are going to collaborate with our governor-mandated Council on Food Security, which was created in 2013. And I do sit in on as a member, as well as the Catholic Charities in Northern Nevada CEO. So we are going to utilize the Council on Food Security to implement the Food Security Action Plan, or the spine-specific Food Security Action Plan. We have one for our Office of Food Security, but we are going to do one that focuses on nutrition equity. And this is going to establish best practices. We're going to highlight the high-risk areas, service deserts, and address rural county specific needs and barriers. Our methods are going to be qualitative and quantitative data collection across the duration of the program. And we really hope to increase community engagement. We want to increase cultural competency in Catholic Charities in Northern Nevada services, as well as their partners, specifically the Food Bank of Northern Nevada, which is their largest partner. And they receive a lot of their foods from a food bank. We'd like to increase food service areas and the number of meals or pounds of food served in those service areas. To complete the comprehensive state food security action plan, or the spine food security action plan with our Council on Food Security. So we are going to identify service areas, increase culturally.
Sarah.
Thank you. Increase culturally relevant foods served in these high-risk areas, and indicate set standards for identification. Spine will encourage these policy systems environment change in addressing these disparities. And I do want to note that Catholic Charities in Northern Nevada is going to hire, they have a chef on staff, but they're going to hire a dietitian throughout the duration of this program, specifically to work with the chef and plan out culturally appropriate meals to be served in their service areas, and then also utilize the dietitian to interview community members and identify what culturally appropriate foods they may already be lacking, and work with the community members and the chef to establish some of those policies.
Great, thank you, Sarah. That's really exciting to have that in place. Does anyone have any questions for Sarah? Well, I do. I'm super excited about this. And one easy question, Sarah, is how long of a duration is this grant?
Yeah, so it is going to be, it's a short grant. It's going to be through December.
Wow, that is short. So that's a lot to accomplish in a little bit of time. And I bet you didn't get big bucks for it either, probably.
No, and that's one of the reasons why Catholic Charities is a great partner too, is a lot of this will just generate momentum for things that they're already trying to accomplish. So we're setting them up for more long-term success.
So just one thing, and we can talk about this offline, but in this I+PSE review paper that we did, one of the things that community, the folks organizing things, one of their priorities, like yours, was to engage the community to really enhance existing partnerships. But they weren't evaluating, did they meet that objective or not? And so there's strategies and tools, existing tools that can be used to do that. And so I just really encourage you, and we can speak offline if you want me to share with you some of those tools are, but I think we need to elevate the importance of this, strengthening and establishing new partnerships, especially you've just got this little bit of time, and it's really going to take those partners' involvement and value, buy-in to really continue to move this forward. So I guess I would like all of us to elevate that as a really important thing to do, but also to measure our achievement of that.
Yeah, no, absolutely. Right. I would love that. Thank you.
Yeah, great. All right. So now we have Utah and the online submission system for WIC eligible foods within the WIC system.
Yeah, so I will represent Utah. My name's Miranda. And so the project that I submitted an abstract on is like pretty different from what's already been talked about, but let me give some background. So I am a health program coordinator for the Utah WIC program. I work at the state office, and specifically I kind of handle more of like the food and formula part of the program. And so I am really involved in the review process when manufacturers submit their items just to be considered WIC eligible. And in Utah, we currently just do that yearly. And so our open season, I guess, for submissions is pretty much December to March. So it's like 3-4-ish months. And our system is a little outdated. We just use an Excel sheet. We send an email. They fill out the Excel sheet. They send it back. I compile everything. It's kind of tedious. So we are wanting to switch to more like an online format to make that a little more efficient. And I think all of the manufacturers would like that as well. So we've started working on that program, but didn't get very far because a lot is going on right now with increased fruits and vegetables. And we have a current submission process going on right now. And then with the recall, so it's kind of taken a back burner. But basically what we've gotten done so far is we are working with an employee from our Department of Technology, which is saving us, a lot on costs because they just work with us anyway. So they're going to try and program this for us. And I've fortunately worked a little bit with Texas WIC because they have an online portal that they use. So they demoed that for us, and we're trying to use some of kind of what they've done to mimic our program. So there's just, so far we've just had a little bit of communication with the people that are involved and kind of tried to hash out the details. I've communicated a little bit with manufacturers on what they'd like to see. I've gotten some manufacturers agree to trial it for us while we're testing. Hopefully we can test it sometime this summer and then tweak it and then have it ready for the next submission period, which will start in December 2022. So we've got about 9 months to kind of figure it out. And we're not very far in the project, but if anybody has any questions, let me know. Or if any of your WIC programs use an online system to collect submissions, I'd love to talk with you to see what works for you. That's all I have.
That's a really great question that Miranda has. Who can give her some experience from your state?
So Miranda, we had, like you said, open season, and we're just cracking up over that. We had open season submissions too for a while when we went to EBC, and then we very quickly realized we did not have staff to house that very long. So we actually allow submissions, but they have to be into us by March 15th, and then that gives us time to review in order to decide what changes we're going to make for the following year for October 1st. And that has made a huge difference because the reps that reach out all the time, they know the deadline. And so they just submit everything to you around that time. And that helps a lot. We do have a way for them to submit mass quantities of UPCs, but it's through an Excel document where they actually have to justify all the nutritional elements and that it is in the state of Montana, because that was the other thing we've had problems with. Or they can download, we have an app and they can enter in all the stuff through the app and then that automatically gets sent to us. So we have a little bit of effort on our side, but that kind of stuff has really helped us. I don't know if that would help you guys.
Thank you. Yeah. And I may have misspoke. We don't let them just submit throughout the year. They can only submit from January to March, and they have to have it in before March 31st. And then we review everything, but it's just using Excel and just email addresses. It's just becoming a little tedious. So we're wanting to update that.
That's great. Miranda, thank you. Any other questions or advice or comments related to Miranda's presentation? I know it might sound tedious, but really important work. Once it's all set and the bugs are worked out, it'll be really fabulous for you all.
And then real quick, Dina just put in the chat, if everyone could add their state organization to their names within Zoom, that would be awesome. Thanks.
Well, that's the last, I think, of our formal abstract submissions for our state partners. Who else, though, would like to share something besides trainees? Okay, all right. Well, I think, oh, go ahead.
This is Sandy, and I just was trying to text Gina about where she wanted me to share about Wisconsin's work.
You could do it now, Sandy.
Okay.
Yeah.
I have slides. Can I show them, or do you just want me to read them? It's not. It doesn't matter.
Go ahead and share them.
Okay. So Dina had asked me to talk about the Children's Healthy Weight State Capacity Building Program. Uh-oh. My slides just went over the top of my button to share. I think I have to share the screen and then drop that. The Children's Healthy Weight State Capacity Building Program. And now I'll share. Let's go. All right, are you seeing my slides now? Yes?
Yes.
Okay.
Sorry.
I have 3 monitors here and they're not working right. So just a second. All right. The Children's Healthy Weight State Capacity Building Program, which was funding ASPHN received in 2020 to establish and support the Children's Healthy Weight Program, to increase the MCH nutrition competency of the state Title V workforce and optimize MCH nutrition related data sources. There are 3 states that are working within this program. North Dakota, Oregon, and Wisconsin. I'm going to talk about something Wisconsin is doing. Robin talked a little bit about what Oregon's doing, a bunch of other stuff, but Dina wanted me to share what Wisconsin's doing. So in 2022, Wisconsin has established a new healthy eating and physical activity objective. And with this objective, they had 9 local MCH health departments and tribal health departments that have self-identified to work on a nutrition and physical activity outcomes over the next 4 years with, that sentence doesn't make any sense. There's 4 tribes and 5 counties that'll be working on this. They're just getting started. And what they're going to do is first start out with a systems approach for healthy communities web-based professional developmental program, working in partnership with the University of Minnesota and Extension, collaborating with their local SNAP Ed and the University and Department of Extensions to support local and tribal health departments in peer-to-peer learning calls and incorporating the systems approach with additional support from Dr. Stang and Dr. Abby Gold from Minnesota. So to start off with, they're going to start taking, now I got to find my classes, just a second. They're going to start taking, using the healthy systems approach for healthy communities training, which will run through the modules are here. There's 5 different modules, and they'll be working through the health department staff in conjunction with local SNAP Ed staff and extension staff and other community partners will be working through the 5 different modules to start with. And these do cover I plus PSC, I believe. That's what, because Dina used them, right? So they've just had their
PSC without the I part, but yeah.
Okay, just PSC, okay. The very first, they've just done their overview. In April, they'll be going through modules 1 and 2. So going on along that way. So they're just starting, but we're really excited about training that many local staff and tribal entities within the communities. And see where it goes. And then, so hopefully next year, I'll be able to tell you about some other exciting things that they were doing. Also, also wanted to share something that I find very exciting that happened with Wisconsin today. I have to get the right document up. So Wisconsin proposed adding some questions on nutrition to the National Survey at Children's Health. And at 1 o'clock today, the proposal was accepted into the review session, so it will be considered. The proposal that, so it's not like they got in, but they're going to get considered. The proposal is to add the questions that were added in 2021 on, in the past week, how many sugary beverages did the child drink? How many times did the kid eat vegetables? How many times did the kid eat fruit? In 2021, those questions were asked for the 0 to 5 population. They have requested to add it to the 6 to 11 population. So fingers crossed on that. And they have also added, and this is the one if they only get one, this is what they want, adding a singular question for ages 0 through 17 on, do you have access to fruits and vegetables in your neighborhood and community? Anyway, so
1 minute warning, Sandy.
And that's it. I did it. Any questions on any of that?
It's really exciting work. I know it's kind of probably slow going and a lot of hoops to jump through, but pushing the ball forward, that's for sure. Any questions for Sandy?
I think we'll love to hear Sandy updates as this gets done, especially around the tribal work and as it, relates to, Sarah's working with her tribal communities. I know we have work in New Mexico. Frank's not here because he's on childcare right now, but in New Mexico, he works a lot with them. We've got Margine on, who is actually from Navajo Nation. And so, that kind of work really we love to hear about, and hopefully you'll share going forward more how that plays out.
Another project they're working on the tribal communities, and 3 of the 5 that accepted that, they're working on community conversations within them too, and working on identifying what they want with, and it's only 3 of the 5, but that's still pretty good.
That's great. Any other state partners wanting to share some of the activities that you're doing? Going once, going twice. All right, we'll transition to our students and their awesome presentations. And the first one, Anna, I'm going to pick on you, and you're working with Megan Mueller, from both of you from CSU. Food security associated with increased stress and frequency of eating out among households with children during the COVID-19 pandemic.
Thank you, Dr. Sabo. It's a lengthy enough title. So in this project, we disseminated a survey through Cloud Research, which is a crowdsourcing platform used to get like a more representative sample of participants. So this survey, it was a cross-sectional survey during the pandemic from November 2020 through February 2021, and it surveyed about 1,500 parents, all low-income parents of children ages 2 to 11. And we were looking at restaurant eating behaviors among low-income parents. We surveyed them asking questions about like differences in frequency eating food from restaurants, reasons for eating from restaurants. They were also screened for food security status using the Hunger Vital Signs 2-question screener, which takes questions from the 18-item USDA food security questionnaire. There was also some questions about perceived stress. And what I am interested in specifically is looking at food security and food insecurity among children or households with children, and how that can impact eating food from restaurants. So what we found, this is some sort of preliminary data, but overall there was a pretty high prevalence of food insecurity, apologies. About 82% of the respondents reported food insecurity. There was also a pretty high prevalence of perceived stress among participants. And what we saw was that participants that reported food insecurity or were screened to be at risk for food insecurity, they reported an increased frequency in eating food from restaurants, even during like this time frame of November 2020 to February 2021. We also wanted to see if there was any impact on specific child food orders. So we kind of distinguished them between healthy versus unhealthy. Unhealthy being like your typical burgers, chicken nuggets, pizza versus quote unquote healthy, which was we kind of determined as like any other option because we couldn't really distinguish between like if there was a sandwich or something ordered. We couldn't necessarily say that was unhealthy or healthy. We just determined it was healthy versus unhealthy. Then we also looked at sides and classified healthy sides as beans, fruits, or vegetables. And then also looked at sugar sweetened beverage intake and desserts. And we didn't see any difference between food secure or food insecure participants and what their child was ordering. But really what this told us, or what we saw, was that overall there was unhealthy food choices being ordered across the board between both food secure and food insecure participants, which just kind of shows us that like in general, and this has been seen in the literature, that restaurants overall are, at least for children, child menus, don't offer enough healthy options, and that most families across the board are going to be ordering less healthy choices for their children. So kind of to close on this, looking at ways to maybe—
A 1-minute warning, Anna.
Thank you. Looking at ways to maybe increase healthy food choices in restaurants, or ways that parents can, or trying to alleviate stress among these parents that are food insecure. That's all I'll say, that we don't know like if it's food insecurity is causing stress or if stress is causing food insecurity. There's definitely, I think, a bidirectionality that exists there, but looking at ways to also kind of alleviate some stress among these participants.
Any questions for Anna? Ask her a really hard one, would you?
Yes.
I did wonder, and maybe I've asked you this before, but were you able to break out by different types of restaurants? You know, sit down or, you know, takeout versus fast food versus, I don't know what the categories of restaurants would be.
Yeah, we didn't look at type of restaurant. We did look at, or we asked whether they ate food in the restaurant versus taking the food away from the restaurant or ordering it to be delivered, but not fast food versus like sit down versus like more traditional style restaurants.
You have like the restaurant name, so we could, but it was entered in. So some of them are like kind of nonsensical answers.
Yeah. Well, maybe in the future.
They're all low income. So on average, they're probably ordering more from fast food than a sit down place just because it's cheaper.
Yeah.
Or probably like maybe local places, Megan, where family run small places, perhaps.
Yeah, or food trucks even sometimes. Yeah, so some of the names might actually be real restaurants and I just don't know.
True. Yeah. Yes.
All right. Well, thank you.
Could Rachel go next, Leslie? Because she's going to have to leave.
What now?
If Rachel could go next.
Oh, absolutely. All right. And you said Rachel?
Rachel, you there somewhere?
I'm not hearing who you're asking.
Maybe she already left. I don't know. I guess we'll just keep going then.
Okay. Well, we've got Amanda Steele coming up from OHSU. And Amanda, you've got a fascinating abstract. We'd love to hear about it.
Thank you. So what we knew so far was in 2021 that those in Kenya, and to start, my project was food insecurity among female sex workers and their children in Kenya. And so anyone that wasn't a mother was eliminated from the study. What we already knew was nearly 70% of those in Kenya and 25% reported being severely food insecure. But what we've found thus far, and this is all preliminary data too, was that 100% of our participants and their children were moderately to severe food insecure. And that impact due to COVID, we know that COVID negatively impacted food security, that nearly all women and children experienced food insecurity, worried they wouldn't have food, unable to eat. We used the FIES, which is the Food Insecurity Experience Scale. And the average age was 30, and the average number of children these women were tending to were 3. So far, on March 8th, we met with UNICEF and USAID and presented those preliminary results. And the first 3 weeks of March, they've been distributed to local partners in Kenya. And we're just encouraging development partners to seek out and actively distribute cash and supplies. I mean, I could talk on it for a long time. I honestly would like questions.
Well, I can start with some simple ones.
Yeah.
And just, tell us how you got interested in this and involved in this, and, and how you're working with the folks there.
Okay. So OHSU is I'm working with Joanna Cummings, and we partnered with Global Health Promise. And so it's funded through Global Health Promise. And our partners there are in Africa right now. They're not back yet, but I have my Kenya data so far, but he's still working in other countries like DRC and Nigeria. So, and it was just presented to me, and I wanted to work with it. It was fascinating. I thought it was a great opportunity to jump on.
So it was survey data then that you were able to use for a research project?
That is correct.
Who has questions for Amanda? Well, I could go on and on and on and ask you about this. Let me ask one more question. Okay. So from these results, like you say, they've been presented to USAID, and I can't remember the other group. UNICEF. And so how powerful of a message do you think this is?
Since food insecurity is a global goal, I would say pretty impactful, because it really targets a population that is vulnerable and is oftentimes overlooked. So I think it's appealing in that way.
And Michaela has a question about, are you going to provide any interventions for them as well, or just look at the general information for now?
The only intervention that we would have to go through others to have any intervention, but our goal is to present and have that intervention go through those organizations, those local partners. So for me, it's more about the message. I guess am the middleman in that scenario.
Yeah. Well, we need the data to justify funding for programs, for sure.
I have a quick question for you, Amanda. So sometimes the FIES is used, to look at the food insecurity, but then other aspects look at dietary quality or access to, a certain array of foods to understand, indirectly nutrient intake, because often, right, we've got micronutrient deficiencies, common ones like iron and zinc and vitamin A, right, iodine. So was there any other component to this that looked at dietary diversity? That's the word I'm looking for. Sorry, it's late in the day.
No worries. So we did collect breastfeeding rates, when started, if they did it all, and when foods were given and what was given to them throughout. So we have all the foods. We have a little bit of supplement data, iron, whether or not they took it during pregnancy or not. It doesn't deal with my project, but I mean, I put it in, so I've got it.
Thank you.
Yeah, so I'm just curious, Amanda, this is Sandy.
Hi, Sandy.
Yeah, I don't know if you've gotten to the point to actually compare the breastfeeding rates, but do you know what they are in this group? And how that would compare to Kenyan women in general?
You mean in a comparison to other Kenyan women versus this group?
Yes.
No, but I can tell you the rate is, it's higher than I expected and longer than I expected. The average was 6 months, and I think it was over 90% without running it and having it in front of me. It was quite a large number. I was surprised, and I don't know how much of that is, reporting bias, but.
Thank you.
Mm-hmm.
I would not expect it to be that high either. So yeah.
Great. Thank you, Amanda.
Thanks.
All right. We have, is it Bryn Burrows, who's going to be talking about family kitchens.
I don't know that Bryn is on with us. Violet, are you prepared to talk about the project?
Sure. So my name is Violet Jimenez. I was a part of this project alongside Rachel, who had to leave. So please forgive me, because I don't think I will do it as much justice as Rachel would have if she were here. But a little bit of background on the project is that it was developed and spearheaded by Dr. Herman and Rachel, which is our the Family Kitchen Project. Ventura County here in California is an online cooking education program that is provided to both English and Spanish speaking WIC participants in Ventura County. And through this program, our research study involves analyzing survey responses to analyze the association between demographic variables such as age, education, race, ethnicity, income, and language spoken at home with the rates of food insecurity, which was measured using the USDA 6-item short form food insecurity scale, and a question regarding the impact of COVID-19 on food access for this population. So based on the data that was collected from these survey responses, some of the results that were provided were that 47.5 of study participants were food insecure, and 36.1 reported difficulty with food access during the COVID-19 pandemic. And then in addition to that, we also noted that older study participants, those above the age of 30 years old, were more food insecure than those under the age of 30, so between 18 to 29. And comparatively between Spanish and English speakers. Spanish speakers experienced greater difficulty accessing food during the pandemic versus the English counterparts. And some themes that were analyzed in this research included fear of leaving their homes, lack of food that was available to them in stores during this time, loss of employment, inability to get to their jobs, and increased childcare responsibilities, given that the virtual world affected everybody and children had to stay at home, and in turn, so did parents. So overall, low-income Spanish-speaking WIC participants were at a particularly higher risk of at a particularly higher rate of food insecurity versus their English speakers, and increasing cooking skills among WIC participants may better support and increase the outcomes for future WIC-related research, post-pandemic. So.
Very nice. Who has questions for Violet?
I have a question actually, Violet, and also if there's lots of noise, we were sitting next to an empty park and now it's quite full, so I apologize. But so you said it was a virtual cooking class, and I'm just kind of wondering did you send out links? How was that kind of distributed, and how did people know about and access it?
Yeah, so Dr. Herman, please jump in. We collaborated with Ventura County WIC and the program managers of the WIC program would send out mass texts to their ongoing list of WIC participants. We do have a running website where they can access pre-recorded cooking education videos, and upon viewing said videos, they can take a survey, and then they would be led to more information to our online Zoom cooking sessions, which are done with undergraduate students at Cal State University Northridge, and they have a whole team working in the background, being able to set up these classes for these participants.
Just add that this was funded by Share Our Strength, No Kids Left Behind. So it's Rachel's thesis that she's writing up at this very moment, probably. And basically, we were testing Cooking Matters program, which some of you may be familiar with. So Cooking Matters is normally provided in an on-site, in-person format. And this was an opportunity to test if, in fact, it could be delivered in an online, either completely recorded or just virtual format. So we had both recorded videos, which our participants watched. And this was the interesting part. I don't know if this has been done other places, but it'd be interesting to hear. They got credit for nutrition education by watching our videos. So we kind of coordinated with the WIC program. This was also kind of along the lines that many people have spoken about today, about kind of making services just more available for WIC participants and not having them, so they can participate more, because WIC participation rates have, been down across the board for many years. And then it was really fun because the focus is on cooking with children under the age of 5. So for those of you who have young children, you can only imagine what that looks like. And we did live cooking classes, both in English and Spanish, and that was just a whole lot of fun. So a little bit difficult to coordinate, but we got some of those done as well. The recorded format was definitely more successful.
There is a question in the chat. Oh, sorry, Dr. Saban.
No, go ahead.
There is a question in the chat from the MCH trainees, and there's two from them. The first one at Arizona State University. Was there any data showing why Spanish speakers had higher rates of food insecurity?
We are still analyzing those data. We're trying to write up this research for a journal. So we're kind of 3/4 of the way there. So stay tuned. We can let you know, but we don't know right now.
My second question is, what ways did the program address access to technology, like a computer, internet? How did the program address those?
So everything was delivered. They can all, we made our app, or that site that you see, all was tested on a phone. And this was really a community-based participatory research type of approach to gathering these data. It's quite interesting in Ventura County, which is a very agricultural, even though it's between rural and urban, there are many farm workers in this area. And so it's interesting because many of the people who work for WIC are actually of the community, like specifically, and have been working there for over 20 years. So it was almost like we were working with promotoras, because anything that we did was really in concert with their consultation. We'd say, well, we're thinking about this. What do you think? And so there's a lot of back and forth in how we developed our materials, the website, how we approached our participants. Everything was really a conversation with them.
And there is one more question, and then we should probably move on to the next abstract. Are there specific reasons why WIC participation is down in the past couple of years? Is it related to lower birth rates?
I think I'm going to toss that to all of our WIC people here in this group, because I'm sure you have lots to say about that.
Well, what I can say from our research so far is it's not. It's a bunch of different factors that are really contributing to it. The shopping experience is what we hear the most about in Montana. So we aren't seeing a trend or seeing data that supports just lower birth weights at all. It's a bunch of different factors coming in that's making it happen. People, for example, we've noticed a lot of our moms that are maybe newer moms are coming in later in life, and it depends on education level, and everybody has access to a phone, and so they get their information way different. So there's a lot of different factors that we have found in our data collection over the last year or so.
Yeah, and Lacey, is that data collection in your needs assessment by chance? Okay, perfect. Because I would love to see more about that just personally. Utah WIC is working on a really big outreach campaign. So we haven't done any specific research like a needs assessment like Montana has, as far as I'm aware. But one thing, and Miranda, definitely chime in with any of your insights on this as well. But what we have done is we've kind of said decreased birth rates may play into it, but we don't think that it's as significant. We don't think that's the primary reason, especially because Utah is generally a pretty high birth rate state. Even with decreased birth rate, the culture here is a lot of women get married young and have kids starting very young and have large families. And so what we found is that there may be difficulty in reaching people. So people not understanding WIC. In Utah, there's also a culture of not wanting government assistance. We are self-sustaining. We don't need help from the government. And so really what we've been trying to do is do a lot of outreach saying like, WIC is good. We provide all of these benefits. It's not just a handout like was discussed in our previous conversation. And also making sure that we are reaching everyone who may be eligible for WIC, but doesn't realize it. So in Utah, at least within our outreach committee, we found that education and trying to educate about WIC, that's been a big goal of ours. Miranda, anything you wanted to add to that?
I just want to quickly say that for a long time, we also have been using paper checks. And only recently, has it even been 2 full years, Danielle, that we've switched to smart card?
I think it's 2 years in October. So yeah.
So we're still pretty fresh into using a smart card. I think that over time, I mean, I hope that we would see more participation, but I think we're kind of stuck back in the times for a while. And so I think the shopping experience was a little difficult for some people, but hopefully it'll improve.
I think WIC technology is a big one. Our big thing here in Nevada is just saying, we need to bring WIC into the 21st century. We did a survey in the summer of 2020, right, as COVID was happening and our redemption rates were declining drastically. It was the shopping, and that continues to be a struggle for people even before it. There's people were scared to do the WIC checkout. Cashiers aren't always the nicest. It's not as discreet as it should be, even with the WIC smart cards. If there's an issue, it can be embarrassing. There's the stigma involved in it. Who wants to go to a grocery store with a bunch of little kids? And if you can do curbside pickup or delivery, and especially now, our SNAP program rolled out with online ordering and delivery in June 2020. And so if you can get your SNAP benefits ordered online and delivered, I think a lot of people are deciding to leave their WIC benefits on the table. And even with this increase in fruit and vegetable cash value, we have not seen any increase. And we've seen increase in redemption of fruits and vegetables, but not increase in participation.
And you hope that the decrease is because, they're getting better jobs, or they, things are looking up for the family, but it's hard to say that that's really the reason why the numbers are decreasing.
That's always the kind of dilemma when looking at that information, isn't it? Are we reaching people enough so that those in need really are welcomed and have access and can participate, or are the rates declining for some other reason? So, well, I think if we have Charisse from Hawaii, I don't know if Charisse is back with us. She had to step away for a while.
She rejoined, yeah.
She rejoined. Great. Great.
Hi. Oops.
All right, Charisse. Well, we would love to hear from you.
Hi. Yes. Sorry about that. Okay. Yeah. So I can share. Should I just go off of what I have, or did you guys want to share the screen? Sorry, not sure how you.
We've pretty much just been, people can click on your abstract themselves, and we'd just love to hear about your project.
Okay. So yeah, I'm Charisse Shelton, and I am in the PhD Nutritional Sciences program at the University of Hawaii at Manoa. And I've been working with Dr. Monica Esquivel, who is also present in this meeting today, on a program, a keiki produce prescription program. And keiki means child in Hawaiian. So it's like a produce prescription program for children. And my abstract is kind of describing our feasibility and impact evaluation of a home-based fruit and vegetable active learning intervention that we added as a component to this produce prescription program. And this piece is part of my dissertation. So aside from me, Monica, from the University of Hawaii at Manoa, we also have the health center that we're working with for this program. So it's the Waianae Coast Comprehensive Health Center. And we have their health promotion staff and also pediatrician that's directly working on this with us. So just wanted to acknowledge them. So the keiki produce prescription program, we had a feasibility study about 4 years ago now. And from that feasibility study, overall the findings were very positive, particularly for those who completed the program. They shared very positive feedback, but unfortunately the program retention efforts, we need to figure out how we can improve that. And in the second launch of the keiki produce prescription program, which just so happened that the launch was supposed to be pretty much right before the COVID pandemic began. So that really we really had to take a turn in how we were going to implement the program. And so what we thought was, well, we'll add a cooking component. Before the pandemic, we were like, we're going to add a cooking component, and hopefully this will help with perhaps retention, because participants will not only be receiving these vouchers to prepare fruits and vegetables in their home meals, but they'll also be able to learn how to prepare these fruits and vegetables in different ways. And hopefully the cooking component would help engage them, particularly the children. So we were thinking of adding that as a component to the produce prescription program. But then the pandemic happened, so we needed to decide how can we implement this in a socially distanced way, or even like a home-based approach. So we thought of something called a food activity bag. And this is basically kind of like a take-home kit that participants could grab after they pick up their produce. And it has like recipes in it. It has nutrition lessons and activities that we developed, and an opportunity to learn about a featured produce of the month. So this bag that we developed, these series of bags, we kind of had to put it together because after doing a search of literature, we found that there wasn't really a home-based kit of this sort that would feature locally available fruits and vegetables in Hawaii. So we developed these materials.
Just a 1 minute warning, Cherise. Just a 1 minute warning.
Sorry. I'm sorry. So we developed these materials, and we made a 6-series food activity bag module. 6-series food activity bags. And in this right now, what I'm trying to see is if there's any impact on children's cooking self-efficacy, willingness to try fruits and vegetables, food and nutrition knowledge from receiving these activity bags. So we have children who are receiving both the activity bag and the produce prescription, and children who are receiving just the produce prescription and will receive an alternative item at the end. And then we're also going to be doing qualitative interviews with the parents and children if they're interested in doing it together. And we're just trying to see, the acceptability of these activity bags, feasibility, and if there's been any sort of impact on their family and themselves from these bags. So, yeah, sorry, it took a little long, but that's basically what we're doing. And if you have any other questions, you can definitely, I'd be happy to chat.
I do have a question, and
Yes.
I tried to put it in the chat and I didn't send it out the right way. So it's really interesting. I didn't know my colleagues were doing a lot of cooking related interventions with children, because that's what I've been doing for a long time. And I just wonder, maybe we should talk offline, but I wonder how you're assessing the children's cooking self-efficacy and maybe their fruit and vegetable preferences, those kinds of things.
Yeah. I'm so sorry. Throughout this whole presentation, I've been receiving a very, very important call. And if I could just pick that up real quick, I'm so sorry about
and
this.
I can answer that question for you.
Sorry. And
Yeah.
okay.
So for fruit and vegetable, we've been using the will try. So we heard of the willingness to try survey, and we use a version that's been adapted with some of our Pacific foods based on some of the work from a colleague at University of Guam. And so I know that for the will try, and then for cooking self-efficacy, I believe Cherise pulled some questions from a number of other references and assessments. So those are
Number
the
of other
two.
studies, yeah.
Yeah. So I think it was not one tool really aligned with what she was looking for. And then for fruit and vegetable consumption, we're using the dietary screener questions.
Great.
Yeah, we can share those tools.
Wonderful. Thank you.
Mm.
All right. Have I missed anyone? Anyone else want to share anything?
We have Lissa on, which is a real super special treat. Lissa moved from California. She was our Western Regional WIC representative, and she had a bunch of other roles, and now she's moved to the East Coast. I don't know, Lissa, anything special? Do you have a couple minutes to share what you're doing or just how you're doing? It's just so great to have you here.
Yeah, I'm here. Hi, everyone. Great to see everyone. And I loved hearing about everyone's projects. My name's Lissa Ong. I have been part of the NLN, I guess, for 15 or so years. I started joining these meetings when I started as a regional nutritionist, or midway as a beginning. So I was working as a regional nutritionist with Food and Nutrition Service in the Western region, and at the time had been with WIC. And so maybe some of you all are here because your predecessors joined along. We helped expand so that Mountain Plains region is now part of this, but many of the WIC state agencies in the West were also part of this. And I guess I've been wearing many different hats in the last 6 years. I moved on to do nutrition work with schools and the child and adult care food program. And I also was able to help support our farm to school program in the Western region. And then in this past year, I moved to Atlanta. And so I'm back with WIC, but working more on the funding side than nutrition, and have had a really fabulous experience getting to know my colleagues in this Atlanta office. And currently, the Southeast region has been working, has provided a leadership training program. And so I meet alongside 3 other colleagues. We've been going through this leadership training program that will, in the end, enable us to be certified professional coaches. And so that has been a really new and growing experience. It's really made me think more. Through NLN, I've really learned and gained a lot of self-awareness with all of the leadership training opportunities provided here, but it's a whole new realm of self-awareness. So it's been a lot of work, but very good work, and it's enabled me to feel a little more part of the Zero team, getting to know some of my colleagues outside of WIC. So that's me in a nutshell, and we're highly recruiting for positions all over our 8 offices, national office being 1 and the 7 regional offices. So be on the lookout for postings for food and nutrition service. And I know Dina has in mind sometime down the road in this year, I can do a little resume 101 for federal positions. So when we get after spring break sometime, we'll try and get that on the calendar. Thanks for the opportunity to share, Dina.
Thanks, Lissa. Any questions for Lissa? Well, I have something to share, so I'll try to keep it without crying, but Leslie.
Oh no.
Yeah. Leslie, who's been with the NLN now for, I don't know how many years, Leslie. Yeah, you hand me those tissues, won't you? How many years has it been, Leslie?
Well, like Lissa, it's been 15 years.
So longer than I've been, here in this leadership position. I just, so she's retiring. We are sad but happy, obviously, for her. And I'm not really sure where to start, but I'm gonna start and say a few words. And anyone who would like to, please chime in. You've been, such an amazing part of our faculty. And I have to say, I met Leslie as a trainee. Yeah, I'm like 5,000 years old. And I have to admit, Leslie, when I first met you, I was a little daunted, right? Like, I didn't know what to think, someone who's just very definitive and exact and very detail oriented. And I felt a little bit under scrutiny, but with some time, I definitely learned to appreciate how honed in you are on all the details, and yet can see, the bigger picture. And I really, learn from you so much by maybe just an observation, because I'm kind of a quiet observer before I actually am bold enough to say anything. You've always been super kind, very welcoming. And even to this day where I'm, came into this directorship role, really, mentored me along. And you really helped me to, stay in the present moment. My mind jumps around a lot. For those of you who know me, I have way too many ideas and never can get it done. And Leslie's only just like, less is more, Dina, just focus in, hang in there, and just, focus. And so she's kept us on track through thick and thin. And I just want to thank you for your thoughtful inquiry, for keeping us present, for keeping me present, and really to help me and guide me to look inside and ask, how should we proceed? How do I want to proceed so that we can, grow this leadership group? So you've been just an amazing part of our faculty partners and our team, and also just an amazing friend and very caring colleague. And I want to thank you for that. And then there's everything else, there's all your outwardly visible contributions, especially in the last 5 years, our childhood obesity enhancement and our work with the I+PSC technical assistance initiative. And we have, Robin here and Chris, and I could really go on forever and ever and ever just talking about all your contributions. And I just want to thank you. And I want to wish you all the best for this next chapter of your life and your exciting new adventures as you move to Asheville, North Carolina. So thank you so much. And then you accidentally got a little gift certificate this morning because I'm a technical idiot. But we have gathered amongst us a small pot, and you will, over the next day or so, receive several gift certificates so that you can explore the Asheville food scene and start to get acquainted with, all the different locations, not all the different, but several of the different locations in your area, and hope that you enjoy those. I'll send you a little email so you know what to be looking out for, because they're going to come via US post, via email, all kinds of different ways. So we really hope you enjoy, and thank you again so much.
Oh, I think I'm supposed to say something.
We could let others chime in and say
well,
if they'd like.
Yeah, that would be good. Damn you, Tina. Let me just say something while I can, and that is that boy, this I know a lot of you don't know me. It's like, why? What is this woman doing, and why is she crying? I have to say that when I took this job at CSU in the Department of Food Science and Human Nutrition, I inherited this little role of being a part of the UCLA's Nutrition Leadership Training Grant, and I didn't know what it was, and I'm just so grateful. I mean, I hope you all really take advantage of the resources that the NLN and the program provides, and for trainees, but also for you state leaders. This is a unique opportunity and a unique connection with your people in the West. And so it's just, it's really been amazing. And I remember Dina and I writing, this big application for a little bit of money for this enhancement related to childhood obesity that connected us with Angie Tagtow and her PSE expertise. And from that, the individual plus policy systems and environmental strategic planning program really emerged. And so I think you all have probably access to our article that was published last year in the Journal of the Academy of Nutrition and Dietetics. That's the framework. Dina is the lead author on a paper that's accepted for publication, which was a technical assistance project involving several of our partners here. And then I mentioned earlier this review article that has been favorably reviewed. I can't say it's been officially accepted, but it will be on the evaluation of healthy eating, active living initiatives, applying that I+PSE framework. And that's where we really identified the importance and the neglected evaluation of community engagement and community partnerships. We all do it. It's all important, but we don't measure it and we don't get acknowledged for it, and it's super critical. So anyway, you can feel my passion in that. And it's just, I'll just stop now. But when my husband and I find a house in Asheville, please contact us and we'd love to have you come and visit.
Leslie, we can have an NLN out in the South now.
I think that's awesome. Actually, I want to go to Hawaii with Charisse and Monica first.
Oh no, but you will be living out this way, so.
That's right. That's right.
Yeah, our wish is to have the next NLN in Hawaii. I'm sure everyone's going to be very upset about that. Robin, yeah, I was going to ask if you wanted to say
Yeah,
something.
I don't know what to say. Like you said it all, Dina. And I don't know how long you've been, maybe you said 15 years. Like, I feel like I'm also one of the dinosaurs here. I'm getting close to retirement age, but I don't know, that's still kind of far away, it seems. But anyway, I just remember getting to know you and all the, years that, you've shared your expertise, and then we go out to dinner together and chat and get to know each other. And it's been great. And just as just a side thing, I know years ago when we were in Redondo Beach, my parents would always come pick me up, and they, every time like I talk about nutrition groups, like, oh, do you ever see that nice lady and her husband that we talked to in the lobby at the restaurant? Like, they always remember you.
I remember that.
You made an impression on them, and they still ask their, it's pretty funny. So I will have to report back to them that
Please
you're
do.
retiring. But anyway, yeah, it's just been really lovely to, get, work with you in this forum. And I've never been to Asheville, and so maybe my daughter's back east, so maybe at some point we'll have to, visit.
That'd be great. Thank you.
Yeah.
One thing I forgot to say, I wrote it down and I forgot to say that the Colorado contingent is in the wonderful and capable hands of Megan Mueller, who will be, she's awesome. You'll get to know her better as time goes on, and her work is just so important. And you're very fortunate to have Megan, me pass the baton to Megan.
And I just want to say that, Leslie, your boots are much too big to ever fill. You've been a beacon of, a real role model, really, of, how to balance academia and life. And it's been so fun to spend more time together in the last couple months for various reasons. And I'm just sad that, we're finally hanging out a lot, and now you're leaving. So I'm definitely coming to Nashville. I hope that's okay.
Yeah, absolutely. Absolutely.
But it's been an honor to work with you and to learn from you. And I'm so excited for you and Mark to go and start this new chapter. And you'll have to send pictures of all the good food.
We can get out in restaurants and be around other people.
Yeah. Gonna miss you though.
Yeah.
I'm supposed to be manning the chat, but my fellow trainee from CSU, her computer's being iffy, so I'm going to read what she said to you, Dr. Sabo. This is from Michaela. Yeah, actually, do you want to just come over here? We're sitting at the same table. This is Michaela.
Hi. I just wanted to say, Dr. Sabo, I'm just so grateful for all the opportunities you've given me, especially just bringing me from the public health world back over into the nutrition world at CSU. And I agree with Dr. Mueller that just how you balance life and work and academia and just everything, like it's really inspirational. And I just appreciate you being you and just your positivity and just always checking in with us and just being really real. And I just learned so much from you. So thank you so much. And I'm so excited for you in your retirement. And I do want to come to North Carolina. So
please come, and we'll have a little bit of time together before I go. But yeah, we really need to have have a little fun time together. I know I work you guys awful hard.
Yeah, and you're my first connection to Colorado, and I just feel really grateful that I got to meet you and do this with you. And I just remember meeting you at Starbucks and just giving me a big hug and making me feel so welcome. So,
And
and
it was
yeah,
outside in the cold.
yeah, because it was like COVID. Yeah, yeah, but kind of feeling like Dr. Mueller of, dang, I just got to know her and now she's gone. But I mean, I guess I'll see you on Monday, but still, I'm very excited for your retirement and sad you're leaving.
Thank you. Thank you.
Well, I'm just going to throw something in here real quick. I only got to meet Leslie once in Washington, D.C. And then this damn COVID. So I want to just say that you're very gentle, very inviting, and really made me feel like I was part of this group. So it's been a real pleasure to get to know you, and wish you the best.
Thank you. Well, I'll be hanging around you all for another couple of months. Maybe I'll make myself really bristly and nasty, so you'll be happy to have me gone.
Yeah.
Anyone else want to share a word? Well, if not, there's more to come, Leslie. We are not getting rid of you just yet, but this
Good.
seemed like a nice opportunity. So
Thank you. Yeah, very sweet.
thanks everyone. And yeah, I think we'll just bring this day to a close. So thanks all for being, it's only whatever 4 hours, but it feels, I don't know, online somehow very, very long, always very intense time. Everything will be up and the recordings. So if you have colleagues who came in and had to leave, or students, whatever, let them know that we will. The live stream is up, so you can, watch that even next day, but we'll have a better kind of cleaner cut version so that you guys can see it a little bit more facilitated in the coming weeks, days, whatever. My Brad's on, so he'll probably get it done lickety split. And just one more kind of plug out there. We actually have 3 different trainings available for you and your team. So, spread the word. We have licenses for the UMN. I'm forgetting the name right now, those modules. So those are the kind of the overall PSE modules. So kind of a baseline, a foundation. We built a short course around module 3, which is just around building partnerships. And, we've found in our work with you how important partnership building is, how much time it takes, and everything that goes into it. So, we're really behind you and leveraging you and your time and your efforts and getting those recognized. So those modules around module 3 are about that. And then we just developed this other short course for looking at the I plus PSC framework for action. And so that's the paper that Angie's the lead author on, and Sharice showed you. We have the promo material up. That course is finished, but we're programming it into our website. So if you have any questions about that, let me know. I'm happy to share the information with you. And yeah, and then we have from Sandy. Thank you, Sandy, for reminding us registration is now open for the 2022 ASPHM virtual annual meeting. It's a great meeting. I have never had so much fun at a poster session in all my life. I mean, there's lots of great stuff that happened at ASPHM, but that poster session, it was Amy actually who presented our work, and it was so well received and it was so interactive. It's just a fantastic meeting. So please register and go. And Sandy, I don't know if you have anything that you want to share specifically, but please do that, and then we'll wrap up for today.
No, I really didn't have anything else. I just wanted to put the plug in for annual meeting because it's a great meeting, and it's the theme is bridging. Let me find it again. Like Bridging the Gap, celebrating 70 years of excellence in leadership. So this is ASPHN's 70th year as an organization. So none of you guys are as dinosaurs as our organization.
Or we're on our second lives.
Yeah.
Thanks, Sandy. Thank you so much.
I guess I just have to plug, the registration is free. So all of you trainees out there, this is a great free conference.
Yeah, it is. And it's a great meeting, just a great meeting of minds. And then I'll just say tomorrow we're doing our leadership training. So you guys are all invited. Obviously, we're going to talk about courageous leadership. So a Brene Brown themed facilitated type of session with some other extra little bits. So we hope that you come, bring your team members, and invite, folks who might be interested. So look forward to seeing you then. And that's all we have for today. So thank you so much. Take care.
Thank you.